Good morning, everyone, and welcome to the third day of the Governor's Office of Disability Affairs conference. Just a few housekeeping. Just want to remind everyone that we are streaming on YouTube. We will put that link in the chat. And just want to thank all of our presenters who are volunteering their time and talents and knowledge to this conference, as well as our staff within the Governor's Office of Disability Affairs, everyone within the Governor's Office and Governor John Bel Edwards, as well as our partner in this conference, Deaf Focus, who are providing our wonderful interpreters. So without further ado, I'm going to turn it over to Dr. Melanie Washington, who will be facilitating this session.
Well, good morning, and welcome to our session on mental health programs and best practices. This morning, I will be moderating this session. I am a Governor's Office staff person, and today we have two ladies with us. I will read their introductions, their bios, but you can also find those bios on the agenda. There's a link to each bio on the agenda. So first, we have from the Bridge Center for Hope, Charlotte Clairborne. Charlotte Clairborne is the executive director for the Bridge Center for Hope. The Bridge Center Board of Directors selected Charlotte in September 2019 to oversee and manage all professional contracts, including RI internationals. Her educational attributes include 2 MBAs in management and healthcare management and a bachelor's in psychology. As the executive director, she will implement the Bridge Center's goals to provide a safety net to catch people in crisis, keep them out of the emergency rooms and jails, and link them to providers to create a continuum of care. Charlotte believes that mental health doesn't discriminate, nor does it have a respect of person, and affects everyone, and no one is immune. Welcome, Ms. Charlotte Clairborne. And second, we have Ms. Lysha Best. Lysha is the Louisiana State Director for RI International, presently overseeing all program services at the Bridge Center for Hope. Lysha joined RI International in December of 2015, serving in various leadership capacities at the Recovery Response Center in Durham, North Carolina. As a licensed clinician, Lysha has been able to provide services for individuals struggling with mental health and substance abuse issues. Lysha's passion has always been to help individuals in need and provide services to those in underserved populations. Lysha earned her master's in mental health counseling from North Carolina Central University and master's in business administration healthcare management from University of North Carolina at Wilmington. So welcome, ladies. Thank you so much for agreeing to participate in this conference. I'm really excited to hear about this program because I've been hearing a lot about it in the community. So I look forward to the presentation. Without further ado, we'll turn it over to you.
Well, thank you first for having us. We appreciate you taking the time to reach out to us for us to be able to spread the word about what the Bridge Center for Hope is, the service and the programs that we provide in the community.
Yes, absolutely. So I think I'm going to get started here on the presentation. And so we're going to show a short video. And in this video, it's going to talk about the Crisis Now model, which is the SAMHSA's national guidelines for best practice in crisis care. So we'll watch the video for a short time, and then I'll go through what the Crisis Now model actually is.
Medical system built to respond immediately to your crisis. Now rewind. It's been a bad day, but this time it's due to a mental health crisis, like thoughts of suicide. The same emergency medical system that responds to chest pain also responds to this type of crisis and is less than ideal to handle it. Yet it is this system that responds to thousands of people in a mental health crisis every day. In general, everyone in a mental health crisis gets routed through an emergency department. There, a person in crisis often waits between 18 hours and 3 days for connection to mental health care. This approach is difficult for patients and wastes a lot of resources. But the Crisis Now model outlines a tested and proven alternative, a way to improve crisis systems across the country by expanding the options for those of us in a crisis, while reducing overall healthcare costs by creating a true emergency crisis service. And there are big savings in the justice system too, while dramatically improving the experience of the person and their family members. Drawn from current national best practices in crisis response, Crisis Now focuses on 3 components that help ensure an appropriate level of care to anyone in crisis. Component 1, a crisis call center staffed by specialists that coordinate all levels of crisis care. They evaluate the current crisis and can support and stabilize up to 90% of the cases they get. Those that need more, get more, with these hubs dispatching appropriate resources and then supporting those resources and finding the best solutions. Component 2, 24/7 mobile crisis teams that work in the streets, meeting people where they are, and for the majority, resolving their crisis right then. Dispatched by the call center hub, they lessen the burden on local police and reduce the stigma that some feel when a uniformed officer knocks on their door. Component 3, crisis stabilization locations, which constitute the retreat model, can offer short-term care for people who need support and observation, regardless of their level of crisis. These programs operate 24/7 and are the right door to everyone in a mental health crisis, including those that may require involuntary treatment. These high-tech, high-touch facilities divert away from the emergency departments and jails while providing immediate specialized treatment. Police no longer need to decide between EDs or jail. The no wrong door approach reduces the time needed to handle these cases from hours to minutes and allows police to go back to supporting public safety, a role they're uniquely trained to do. Let's review the impact of the Crisis Now model in Maricopa County, Arizona, 4th most populous county in the US. In 2017, Maricopa County Police connected more than 23,000 people in a behavioral health crisis directly to crisis care. And those people were accepted 100% of the time. The Crisis Now initiatives saved the time equivalent of 37 full-time officers, reducing wait times in emergency departments for behavioral health patients by a total of 45 years, saving local hospitals and emergency departments a total of $37 million in avoided costs and losses, freeing them up to help the patients they're designed to treat, while routing behavioral health patients to a course of care that's best suited to their needs, and reducing Maricopa County's overall healthcare costs by an estimated $260 million, more than twice the cost of Crisis Now services. To learn more about how Crisis Now can make a difference in your community, go to crisisnow.com and download our white paper.
Okay, so that video was about the Crisis Now model. And so the Crisis Now model is really figuring out how we can best provide crisis services in your communities. As of right now, this is the current flow of, go back, Charlotte. Sorry. As of right now, this is the current flow that happens when someone is in crisis. So when someone's in crisis, they either engage, most times they engage with the police or law enforcement of some sort. And then they go to a hospital setting. And within that hospital setting or jail or prison is really not set up to deal with individuals in crisis. So they end up either being declined of services or referred somewhere else, or they end up just leaving the hospital against medical advice and not really receiving any type of services for the needs that they actually came in there for. Go ahead, Charlotte. So the Crisis Now model really focuses on a different route that we can go. So instead of sending individuals to hospitals or jail, we really want to focus on a pathway that is beneficial for the individual in crisis. So if they do come in contact with law enforcement, they would go to either go through a mobile crisis unit, meaning that individuals will go out into the community and meet with them and try to stabilize the crisis there, or they will come straight to a crisis facility, which we'll talk about a little bit throughout our presentation, which is the facility, the Breaud Center for Hope here in Baton Rouge, Louisiana. Go ahead. So the Crisis Now model really focuses on 3 components. So the first one is a crisis call center hub. And within that call center hub, individuals are able to call a general number that they're able to receive some type of services, and they'll able to navigate that crisis on the phone call. If they can't do that, then they will move to the next step, which would be the crisis mobile teams. These individuals will be dispatched from a call center, and they will go out to meet that individual where they are, try to navigate that crisis in the community. But if they can't, they would then bring them to a crisis receiving center, which, like I said, is here in East Baton Rouge Parish. So the crisis recovery, so our campus of connection model is what we call it. So it's really about focusing on all the services that we can put into one place. So here at this facility in East Baton Rouge Parish, we have our 23-hour observation unit. So individuals can come in, get assessed by nurse practitioners. They get psychiatric evaluations, nursing assessments and such. And then we also have our short-term crisis beds, which we call our living room model. We have a respite unit. We also coordinate with the pharmacy to make sure that we get medications here. We have a care management team. And then we also make sure that we coordinate with outpatient services to, when they discharge, that they have good appointments. Also at the campus of connection, our facility, we really focus on peer powered. So a certified peer support specialist is someone who has lived experience. Either they've gone through some type of mental health challenge in the past or substance use challenge in the past. And they've kind of gotten to a point where they can talk about their story. So we really focus on those individuals. So we call it peer first, peer last. So that means that when an individual comes into our facility, they're met by a peer. So they talk to them and connect with them about what the issues are in the community or what they've gone through. And then before they leave the facility, they also talk with a peer. So that's why we try to make sure that we do peer first, peer last, so we can really treat individuals with empathic understanding and really connect with them. Also, our facility, we do direct law enforcement drop-offs. So individuals that come to this facility, they don't have to have medical clearance. So they don't have to go to a hospital first before they come to our facility. We're really focused on making sure that the facility is open for law enforcement officers and first responders to drop individuals off very easily. And then lastly, we're really focused on whole health. So really integrating mental health and substance use when they come into our facility. Keep clicking through for me. So just to sum it up about the Crisis Now model. So as we saw in the video, Crisis Now really focuses on a different model that we typically did in the past. And so with the Crisis Now model, you can see that it's 6 times better a clinical fit for the individual that's in crisis. And then also, since we are so accessible to law enforcement officers, it saves the time of about 37 full-time law enforcement officers, 37 law enforcement officers' time, because we actually quote a drop-off time of about 5 to 7 minutes, opposed to the 3 to 4 hours that it takes for them to drop someone off at the hospital or at jail. Also, it saves the time of about 45 years in hospital waiting areas, because when an individual goes to a hospital setting to receive crisis care or mental health care, they're there for about 18 hours before they get to see someone. Go ahead and click through. With this service, with the Crisis Now model, you're actually able to, they found that you're able to save about they're able to save about $260 million in mental health services, in how much it costs to provide this care, and then also $37 million in avoided costs at the hospital. So all these numbers come out of Maricopa County, which our facility, RI International, that's our first facility. And so all these numbers come out of Maricopa County, where they've seen at least 23,000 people dropped off from law enforcement officers. All righty. So now that I talked about Crisis Now, and now I'm going to get into talking about RI International as a company. So very generally, RI International, we're a international behavioral health company. And so we've been around for about 30 years providing mental health and substance use services. So we tend to think that we are the subject matter experts in crisis care. And so we take a lot of, Charlotte, click through for me. We take a lot of our practices from Walt Disney, and Walt Disney said very well that whatever you do it well. So we try to make sure that we're able to provide good care at all times because we want people to come back to us when they receive good care. Click through. All right, so where can crisis go from here? So what you'll hear throughout my presentation is about at the facility, we focus on recovery care. And then we also have this model called no wrong door. So no wrong door approach just means that we don't turn individuals away. If someone's in crisis, they should not have to try to figure out where they should go to receive care. So if an individual presents to our facility, no matter what that is, they would not be turned away at the door. They would be greeted, and then we would try to figure out what the crisis is and how best we can help them. So the RI way. So the RI way, we focus on 4 components. So we focus on peer power, performance, engagement, and safety. Go ahead, Charlotte. All right. So peer powered. So peer powered just means that, like I said, we use certified peer support specialists. So about 50% or 55% of our entire company is an identified peer. So we really focus on that engagement aspect and utilizing certified peer support specialists. We have a living room model. So a living room model really means that when you see the pictures, you'll see that our facility is very open and welcoming. We don't put barriers between ourselves, the staff, and the guests. We do call the individuals that come into our facility guests and not patients or clients, because we do like to feel like they're at home with us, and we want to make sure that we're able to create a very open and welcoming environment. And then we also use a no force first model. So that really means that we really focus on engagement and really trying to figure out how best to help that individual, because we don't like to use seclusion or restraint. Although we don't like to use it because that means that is a fail on our part if we do have to use that. So we try our best to use no force first and use our talking skills, engagement skills, and our peer support specialists to meet that individual where they are. Go ahead and click through for me. So another aspect of peer power practices just means that we're in collaboration. So we do with you and not to you. So whatever plan that the individual comes in with, we try to work with them on figuring out what's the best course of action. So coming up with their treatment plans and crisis plans and all those kinds of things, we work with them and we don't come up with the plan for them. So it's strengths focused. We always make sure that we talk to them about what are some things that you're good at? What are some things that you want to continue to grow? A lot of people that come into the facility, they do not really, sometimes they don't know what their strengths are. So we try to make sure that we focus on that and help them get to that point. We work on whole person wellness. And so when an individual come in, we don't just help them with substance use. We also talk to them about their mental health or vice versa. And then when they discharge, we also make sure that they have a primary care appointment because we want to make sure that they're able to focus on their whole health. Trauma-informed care, as we all know, trauma is very prevalent in this community, and we want to make sure that we're able to address those needs when we need to. And then once again, our no force first model. All right, so our performance aspects of the RI way, as I spoke about a little bit earlier, is our no wrong door policy. So why does no wrong door matter? So it really, like I said, it really means that if a person's in crisis, they get to come into our facility and figure out what that crisis is. We don't turn them away. And it really doesn't matter, although this facility is for East Baton Rouge Parish, We try our best to make sure that it's accessible to anybody that's in crisis. So even if they're from a different parish, if they come to this facility, we would accept them, try to figure out what the crisis is, and then we would get them back to their parish of residence. We always find ways to say yes. So no matter what the situation is, we would find a way to say yes. We don't want to say no to individuals because once you start putting barriers in place, people decide not to come to treatment. We manage what they call quote unquote medical clearance. So like I said, most facilities, they want someone to go to a hospital first to receive medical clearance. That's not what we do here. We typically do a triage, and we have a triage process just to make sure that the individual is safe enough to be at the facility, but we don't require an individual to go to the hospital before they're able to come to us. We manage substance use disorders because we have a detox unit here at the facility, which we'll talk a little bit more about in a little while. Go ahead. And then we manage high acuity. So individuals, like I said, at least half of the individuals that come to our facility come via law enforcement. So we really don't know who's going to be coming. So all the staff here are trained to manage high acuity individuals. And we try our best to address those needs when they come in. And I think we are all trying to do our part in fighting the stigma about mental health and substance use. So we want to make sure that, that the facility is accessible to anyone that may be struggling with mental health or substance use. You can click through. Go ahead and click again. All right, so another aspect of our RIA is engagement. So like I spoke about earlier, so we try our best to engage with the individuals as soon as they come through the door. So we engage with our guests, we engage with our community. So Charlotte and I, we go out into the community and have these conversations, make sure we're providing education to the community so everyone knows that our facility is open for individuals to receive care. And the last aspect of our RIA is safety. So when individuals come in, we do lots of screening and assessments. We screen for suicide ideations, homicidal ideations. We also do treatment planning. We collaborate with the individual. And then we also make sure that they have appropriate discharge plans when they leave. So this is, as I was talking about, this is one of our facilities in California. And so it's very open. We want to make sure that our facility is warm and welcoming, and we don't put any barriers between us and the individual receiving services, so they understand that we're there to help them. So these pictures are just pictures of our few facilities that we have across the country. Right now, we have about 14 facilities across 9 states, New Zealand, and Australia. So like I said, we've been providing this care for a while, and we're really excited about the facility here in Baton Rouge, which Charlotte is getting ready to talk about.
Quick question. Did you guys want to address questions now? We have a couple of questions from some attendees.
We do have a section at the end that has question and answers, so we may answer their questions as we go through the presentation.
Okay, we can wait on it.
Okay, so this is the Bridge Center for Hope facility here in East Baton Rouge Parish. This is just the front portion of the building. But what I wanted to do is kind of go back. What Lysha was giving you the best practices. And the reason why we went with the best practices first is because that was one of the reasons why we chose RI International as the service provider for the Bridge Center for Hope. But what I've also like to do when we educate people on mental health services and substance use, we have to also go back to the beginning to understand how we got where we are today, because it didn't happen overnight. So a lot of people fail to realize, but back in the 1950s, there was a deinstitutionalization of state mental health hospitals. And when they started doing that disinstitutionalization or that destabilization of these hospitals, what it did, it allowed people who were being discharged, they were being discharged without the assurance that they would receive appropriate medication and rehabilitation services necessary to live a successful life in their community. So what that did as a result is it left a population of individuals who had mental health issues and possibly substance use issues, either untreated, undertreated, or self-medicating. Here in Louisiana, we only have 2 state hospitals. That's Central Louisiana on the left, which is located in Pineville, and East Louisiana on the right, which is located in Jackson, Louisiana. So we had a bunch, and then this is what we were left with. And to sum that up, to give it perspective, is right now there is a 4 to 5 year wait period to get into the Central Louisiana state facility right now for long-term care. So when we take that information and we hone into East Baton Rouge Parish solely, we realize that over the last 10 years, we have seen a rise in the number of mental health cases and substance use cases, not only here in East Baton Rouge, statewide and nationally as well as a whole. But when we look at it, we say, okay, what contributed to East Baton Rouge Parish's rise? And there are a couple of things that stand out. One being the closure of Earl K. Long. For those who are not familiar with East Baton Rouge Parish, Earl K. Long was a charity hospital we had here in Baton Rouge, and Earl K. Long had within its facility what was called a mental health emergency room extension that saw about 2,000 people annually, and it provided mental health services. And what it did, it allowed law enforcement or first responders, if they came across someone who had a mental health challenge or a substance use issue, they will be able to go to Earl K. Long to take them to be assessed. So again, when that facility closed in 2013 due to budget cuts, it left a void. So you had people going either to parish prison or they were going to your local emergency departments. In 2015, following Earl K. Long closure, the emergency department of the Baton Rouge General Mid-City campus closed. So you're taking that 2,000 population from Earl K. Long plus the combination of however many people were being treated at the Baton Rouge General Mid-City campus, and then you're leaving a void in our parish with people having nowhere to go, because you also, in combination, you have to look at demographics and logistics. These hospitals were fairly close. They were the one in Mid-City was like in the middle of the parish. The one, Earl K. Long, was closer to the northern half of the parish. So when you close these 2 facilities, you left a void of services that can be provided for people who had logistics issues trying to get the help that they needed. So when you look at this number here, this right here is the information from the coroner's office for East Baton Rouge Parish. And in this information, it talks about the number of OPCs and CECs. And what OPC stands for is Order of Protective Custody. In order to get one of these, you have to go to the coroner's office and fill out an affidavit and explain to them that you've witnessed a particular person under 3 conditions. Either they are a danger to themselves, they are a danger to others, or they are gravely ill. And once they fill out this affidavit, it's given to a law enforcement individual, and they will go try to locate that person. And then they will bring them to an emergency department, now the Bruce Center for Hope, for them to get a psychiatric evaluation. That CEC stands for Coroner's Emergency Certificate. So you have to have 2 forms, 2 evaluations in order for somebody to be held involuntarily. So you have to have a CEC from the coroner's office, and you also have to have a PEC from the physician. So for example, if you were to take someone, if someone was to do an OPC on you, Order of Protective Custody, the law enforcement officer picks that person up, bring them to the emergency room, then the physician on call or the physician in the emergency room will do a PEC, and then they will call for the coroner's office to do a CEC. That's how someone is involuntarily committed if they both sign off on it. Both individuals have to sign off on it, the coroners and the physician on call, or the physician that's seeing that individual. And the reason why I wanted to show this particular graph is because this is mental health cases. And if you look at 2011, when the emergency room extension for Earl K. Long was open and the Mid-City campus at the Baton Rouge General was open, our numbers were relatively low. We had 473 OPCs issued, 3,152 CECs that were issued out of the coroner's office. And when you fast forward to May of 2021, we've already exceeded those numbers for a whole year in 2011. So that lets you know that we're on track to either equal 2020 or surpass it. Right now, we're looking at 3,214 CECs and 526 OPCs, and that's from January to May. So we still haven't tracked the numbers for June or July, and we still have several months to go by the end of the year. This next slide talks about the number of fatal and non-fatal overdoses that we have here in East Baton Rouge Parish. And by looking at the graph, you can see that East Baton Rouge Parish is on track to surpass the 2020 record-breaking numbers of 242 fatal overdoses and 1,014 non-fatal. Right now, this chart represents to the end of June. So right now, as of June 30th, there were 115 fatal overdoses and 718 non-fatal overdoses. So we talk about these things and we look at these things and we wonder, as a community, what are we supposed to do? And at a parish level, we kind of went back to say, okay, we realized that the mental health community, the substance use community is suffering, and we need to figure out a way to do that. And so therefore, that birthed the Bridge Center for Hope out of the Baton Rouge Area Foundation. They put together several key stakeholders. You had community advocates, you had the Justice League, Justice Departments, you also had behavioral health specialists that came together and formed the Bridge Center for Hope, the nonprofit. And what that nonprofit did is they tried to figure out a way to bring back a mental health facility here in East Baton Rouge Parish that will be able to treat the most vulnerable, the ones who, some people consider left behind. And in 2016, they went and tried to solicit a parish tax to be able to fund this facility, but it didn't pass. So after extensive research and getting with consultants in 2017 to educate not only themselves, but also to educate East Baton Rouge Parish residents as to why a mental health facility is needed, they went back and put the parish tax back on the ballot in 2018, where it passed by 64%. So more than half of the residents agreed to tax themselves to be able to fund a facility that will be able to provide mental health services for its residents. So we look at what's the purpose of the Bridge Center for Hope. And really it is to provide 24-hour, 7 days a week comprehensive crisis care for voluntary and involuntary individuals in East Baton Rouge Parish that are 18 years and older. And it also provides crisis services to individuals who are suffering from a mental illness or a substance use challenge, regardless of income or insurance, meaning that parish tax that the Bridge Center passed. If someone is having a mental health crisis and they come to the Bridge Center and they don't have insurance, we operate under RI's no wrong door policy. So we don't tell them no, we still provide services. If they don't have insurance, we still provide services. The Bridge Center for Hope covers the indigent population. So there's no reason for anyone in East Baton Rouge Parish to say that they couldn't receive services at the Bridge Center for Hope because they didn't have income or insurance. That's not a barrier for us here at the facility. We take those barriers away so that you can get the proper care, so you're not worrying about trying to receive a bill, because you will never receive a bill from the Bridge Center for Hope. The only criteria that we really have is to be 18 years and older. And we try to stick with East Baton Rouge Parish residents because it is a parish tax. However, we're not going to turn people away if they're in crisis. So we did get a grant to be able to fund some of the individuals that are out of our parish. And then lastly, which is the Bridge Center motto, is to provide pathways to treatment for people who are experiencing a behavioral health issue and link them to providers to create integrated continuum of care from prevention and to rehabilitation. So what does that mean? It means that individuals who are entering the Bridge Center for Hope for treatment, regardless if it's for a mental health crisis or for a substance use crisis, what we wanted to do was make sure that when they left the facility, they were given an outpatient appointment with a provider. So we're connecting them to outpatient providers so that they can continue in their care. And that was one of the things that was attractive to the Bridge Center for Hope Board of Directors when RI was selected as the service provider, was that they had all of this already in place, and they had been practicing these mottos for several years before we came on board. So it was kind of like a no-brainer for us. Even though we did solicit proposals throughout the country, they were the ones who ultimately won out. So as Lysha had alluded earlier, it was the Bridge Center for Hope, the nonprofit, and we did that solicitation proposals back in 2019, and RI International was selected, and that's how we're here together today. They provide the services for the facility. So what I wanted to do is show you guys a quick little 2-minute video. It's just an overview of what the Bridge Center for Hope is, what it looks like, and what is offered in the facility. And then there are a few slides that go more in depth as to what the facility contains and how each unit is operated. And Lysha will be able to explain those to you a little bit more in depth in a minute.
When we took a deep look at our community, we saw that thousands of people living with mental health and substance use challenges were not getting the care they deserve. We saw a great opportunity to better support people in crisis. For many years, people in crisis were being dropped off at already overcrowded emergency rooms and local jails, which made our community say, there has to be a better way. Introducing the Bridge Center for Hope, a new state-of-the-art crisis receiving center, a place where people experiencing mental health and substance use challenges can get the help they deserve. The Bridge Center for Hope utilizes the Crisis Now model, an evidence-based approach to crisis care that provides immediate help for those in distress, prevents suicide, reduces cost, and the strain on emergency rooms and prisons. We created a safety net to stabilize people with mental health and/or substance use challenges by providing immediate crisis services and connecting them with service providers and community resources. Services include 23-hour observation unit, 16-bed short-term psychiatric unit, 16-bed medical detoxification unit, 16-bed center-based respite unit, care management team, and a mobile response team. The Bridge Center for Hope, in partnership with RI International, provides individualized treatment and resources that will help East Baton Rouge Parish residents 18 and older overcome their mental health and substance use challenges and lead healthy, happy, and fulfilling lives. Learn more about the Bridge Center for Hope at brbridge.org.
So this right here is the actual facility. It's located at 3455 Florida Boulevard, which is directly across the street from the Baton Rouge General Mid-City campus. And I want to say this, the Baton Rouge General recently opened up their emergency department last year in 2020 to have full services. Keep in mind that they were closed from 2015 and they reopened again 5 years later, which is unheard of and unprecedented. And we're so thankful and grateful that that community asset came back to East Baton Rouge Parish because it was greatly needed. And the fact that they're directly across the street from the Bridge Center for Hope is also a huge plus for us as well. So the next slide is the overview of the actual facility. Each one of these colors represents a different unit, and Lysha will go into each unit explaining how those services are provided and who provides those services.
Yes, absolutely. So I'm looking at the time, so I'm not going to stay too long on it because I do want to get you guys questions. So this is our 23-hour stabilization unit. So this is our entry point for any individual that come in our facility, either voluntary or involuntary. They will start on this unit. So on this unit, we have 16 recliner chairs, and it's set up just for optimal observation, because within that first 23 hours is when we decide or think through what's the best course of action for that individual. So on this unit, we have psychiatrists, psychiatric nurse practitioners, RNs, LMHPs, so LCSWs or LPCs, certified peer support specialists, and then also milieu specialists. So when individuals come in, they receive a clinical assessment by an LMHP, a nursing assessment, a psychiatric evaluation. They also have individual and group therapy, and then we also really focus on peer engagement. So after that first 23 hours and those assessments happen, like I said, we really decide what happens with that individual. Some people are able to be stabilized, and then we discharge them back to the community with an appropriate discharge plan with appointments and such. But if they need a longer term stay, longer term for us means 3 to 7 days. So if they need a longer term stay, they can go to our short term psychiatric unit if they have a psychiatric diagnosis. Over there, we have 16 beds. So we have 8 double occupancy rooms. And it really focused on additional stabilization for that individual and med management, making sure that they're on the medications that they need to be on. And over there, we have the same type of staff, psychiatrists, nurse practitioners, nurses, and such. And they have a really robust daily schedule on this unit. They have about 4 to 5 groups a day, daily treatment sessions with the nurse practitioners and the licensed mental health professional. And then they also do peer engagement. We do art therapy, music therapy on this unit as well. They can also go to our 16-bed medical detoxification unit. So over here, we have 7 double occupancy rooms and 2 single occupancy rooms. So it's designed for individuals needing detoxification from some type of substance. We have the same type of staff over here, except for on this unit, we did have to add an addictionologist that specializes in addiction medicine. They have a bit of a different schedule, meaning treatment schedule, but they have the same amount of groups per day, daily treatment sessions as well, and individual and group therapy. We typically try to have an outside space, but because of where the facility is located, we did have to become creative and figured out a way for the individuals to still be able to go outside. So we built a patio on the side of this unit, which they really enjoy going out and just getting some fresh air. Go ahead. We also have a 16-bed center-based respite unit. So our respite unit is our lowest level of care at the facility. We, on this unit, individuals will go over there so they have some type of respite away from their living situation so they don't go into crisis. We also would use this unit as the middle point between the individual's discharging from the facility and their next step. So if they're going to like a sober living environment and their bed is not ready for about 3 days or so, we want to make sure that they remain safe. So we would transfer them to our respite unit so they can, so it's not a gap in their care. Our last 2 services are, we have a care management team. So our care management team is a 2-person team, so an LMHP and a certified peer, and they function as like a discharge planning team. So they make sure that individuals have good discharge plans when they leave, make sure that everyone discharges with an outpatient appointment, either mental health or substance use, and also a primary care appointment. And they're also able to follow individuals in the community for up to 30 days. So we can do a warm handoff from the staff here at the facility and to the staff, whatever the next step is, whatever that appointment is. We want to make sure that we do a warm handoff. And then our last service is our mobile response team. So it's a 2-person team as well. And then we will respond to, from 911 dispatch, they will dispatch us with a crisis in the community, and then we will respond to that crisis. So we will try to stabilize them in the community, but if we can't, the team would go ahead and transport them to the facility.
So you've kind of heard about how the best practices work and then how those best practices work here at the Bridge Center for Hope. And a lot of people want to know, how are we doing? And so we opened on February the 11th of this year. And so far we've been open a little bit over 159 days. I think when I did this presentation, it was 159, so now it's about 160, 161. Of those days, from February the 11th to June 30th, we've seen or admitted 829 guests. 51% of those individuals receive mental health services, the other, and 49% receive substance use. And then there's a combination in there, but that's not identified. 58% of those guests came to the facility independently, meaning that they came on their own or they came with a family member, but they were not escorted by first responders. 48% were escorted by first responders, and that could have been law enforcement or that could have been EMS. And then for East Baton Rouge Parish, our Baton Rouge Police Department accounts for 66% of the first responder escorts and followed by 21% EMS. When Lysha spoke earlier with the Crisis Now model, where they were speaking about trying to get first responders in and out between 5 to 7 minutes, the Bridge Center has actually exceeded that time by 3 minutes and 71 seconds. That's our average handle time to get first responders in and out of the facility. So if you have any questions, this is our contact information. I thought my next slide was going to be a Q&A, but I guess it's not, but I'll go back to this one in a second. There we go.
Okay, you guys are ready for questions?
Yes.
Okay. So there is a question in the chat. One was already answered. Do children have access to the crisis services? So they have to be 18 years or older, right?
Yes.
And the next question is, will there be appropriate accommodations for developmentally disabled, particularly if they're severe?
Yes, we do. Yes, we do. So we handle those cases on a case-by-case basis. And any individual that come in, we try to connect with the resources that they would have already had in the community. And if they don't have those resources when they come in, we will work together. We do a treatment team meeting to make sure that we connect internally and then also lean on those community resources to make sure that we are able to provide good whole person care. So yes, we will make those accommodations.
And this is Bambi. I think to get to the heart of what the intent of those questions is, because I know this very well, is that we don't have that integrated type of care for our people with developmental disabilities and behavioral health. So do you guys have the expertise and I guess the resources or maybe some knowledge that many of us in the community don't have on how to get that integrated type of care for people with developmental disabilities and behavioral health needs?
Yes, so I will not say that we are the subject matter experts in developmental disabilities. And so we do work on making sure that we continue to develop that, but I can't say that we are the experts in that area. But if an individual comes in with developmental disability and behavioral health, we will work together to try to find those resources in the community as well.
Okay, the next question from YouTube. No, I'm sorry, before YouTube. What number does a person in crisis call?
Oh, that's easy. Well, that number for whoever wants it is area code 225-256-6604. That's the number to the facility. But I also want to stress that if someone is in the middle of a crisis or they're having suicidal ideations, you still also have a resource with United Way where 211. So you can still dial 211 and do option 3, and then that will give you to a crisis person as well. And then also 911 is always accessible.
Okay.
And if you are in crisis, you don't have, if you're in East Baton Rouge Parish, you don't have to call the facility first. You can just show up to the facility. That would be the best course of action.
Do you do any training and outreach with law enforcement agencies to help officers identify someone in a mental health crisis and then call the crisis team ASAP?
Yes, we do. So we participate in the CIT, so crisis intervention training for Baton Rouge Police Department. And then we also provide any education to any law enforcement entity about mental health, how to identify those individuals. And then that's another reason why we try to, as a company, we try to remove all the barriers for law enforcement because they are not the experts in that area. So if they come in contact with an individual, we just want them to bring them to us and we will figure it out. But we do also, like I said, we do provide education to them and the community as well.
Okay. Will they have centers for children and children with disabilities?
So that's something that the board of the Bridge Center for Hope has been looking into, is providing services for individuals under the age of 18. We're not there just yet because we just opened this facility. So in the coming years, we will revisit that topic, but that is something that we really want to get into because we know that mental health doesn't start at onset at 18. So we want to be able to provide some type of services for our adolescent population.
Okay. What is the staff to patient ratio?
So typically we have about 8 staff members to 16 guests.
Okay.
On each unit.
Okay. It's to 16. Okay. It's like 1 to 2?
Yeah.
I mean,
except for our respite unit. Our respite, like I said, our respite unit is our lowest level of care. And so the individual over there are pretty stable. They have to be independent, know how to take their own medications and such. And so over there, we have three staff members to 16.
Okay. Do you do family counseling sessions? And if so, how many?
We do have the capacity to do family counseling sessions if the individual requests it. Because if the individual comes in and they're struggling with their family or natural support, and they feel like they need someone to mitigate or manage that conversation, we can do family sessions. Yes, it is on a case-by-case basis.
Okay. Can families helping families refer families to your center by providing them with your information, or is there a referral process?
No, we don't have a referral process. No. So like I said, I know it sounds like too easy, but anybody can come at any time. We don't have a formal referral process. You can call the facility and talk to a shift supervisor if you wanted to provide us with like collateral information, but you don't have to call us first.
Okay.
Excuse me, this is Bambi. Just want to remind the interpreters to please don't spotlight when we don't have a presentation showing for recording purposes.
Okay. The questions are rolling in, but we have a few more minutes. So do you do any, let me see if I could change the view on my screen. Okay. Do you do any training for teachers and school administrators? Some of our students are 18 and older.
Do we do currently? No, we don't. Currently, no, we don't. But that's definitely something that I'm sure Charlotte and I will have a conversation about to make sure that we get out there and have those conversations with them. I know, COVID kind of slowed us down because when we started, we were full speed ahead and then COVID kind of slowed us down. So we're trying to get that momentum back up, but we're definitely going to go out there and have those conversations with them.
Okay. What is the status of developing a 911 for suicide crisis services in Louisiana?
Yeah, so 988 is rolling out right in 2022. But I think I don't have the status for Louisiana. That's a way bigger question than me. That's a state rollout plan that I'm sure is going to come from LDH. So 988 is coming next year, but the states have to have their plans set on a governmental level.
Yeah, the last thing that I heard in a meeting was it was scheduled to roll out in July of 2022. Now that's yet to be seen, but that was just the last information that we received at the time. But that's, don't hold me or us accountable for that particular time frame.
Yes, everyone has to come up with their own plan.
Okay. And I had a question. You talked about the peer professionals. Mm-hmm. And so I like the peer first, peer last. Who would be considered a peer? How do they qualify to be a peer?
So a certified peer is anyone that have lived experience. So they would have had to gone through some type of mental health challenge in the past or a substance use challenge. And they've been clean for a little while. They go through, we provide a 2-week certification course, talking through with them how to tell their story, how to connect with individuals, how to have an empathic approach. And what we found is that I'm a licensed clinician, and I really rely on the peers to have that conversation with individuals, because I've never gone through a substance use challenge, so I can't connect in that manner. So that's why we do a peer first, peer last. So they get to build that connection, then they go through with the clinical stuff, and then continue to do the peer engagement. And then also when they leave, they talk to a peer again to further solidify that, if I could have done it, I did it, this is what I've gone through. So I'm sending you out now, and I'm trying to give you all the skills that I learned, so you can also get there.
And to answer that question on a state level, the state does provide peer certification training classes, and it's an actual model that's based off of RI International.
Yes, our peer model is the one that the state of Louisiana uses to certify their peer support specialists.
Yeah. So if they go to LDH's website, they'll tell them when they have classes if they're not here in East Baton Rouge Parish or working for RI.
Very good. And so the criteria is there too, like how long you would have had to been, I guess,
recovery. Yes, in recovery. Yes, absolutely. Mm-hmm.
All right, we'll take one last question. And this is from the YouTube live stream. Do you have a criteria or a certain level patient that you would not deem as a patient for your facility?
No. So like I said, the biggest criteria for us is you have to be 18 and over. That's the biggest thing. But when individuals come in, like I said, we just have to make sure that they're medically stable to be at this facility. So we try to say our facility is like infirmary level. So we make sure we can deal with like high blood pressure, diabetes, and stuff like that. But anything that's like super serious, we will have to get some further assistance from a hospital setting of some sort. And then they will come back to us. But yes, we don't have any like a major criteria or anything like that.
Okay. I guess it's convenient that Baton Rouge General is across the street, maybe?
It is. Yep. It's convenient. We work with them. And then we also work with Our Lady of the Lake as well. We try we actually utilize the both of them.
Okay. Charlotte was going to say something?
No, I'm just smiling.
So Bambi.
I'm the only criteria that they probably wouldn't take is something if I walked in there, like, no. So.
Bambi has a question, so she'll get the last word.
Yeah, so my question is, this seems like a great model and a great that East Baton Rouge residents saw the need and passed this tax, but we have many people who are listening and watching, or people who are advocates and kind of system change advocates. And so what would you suggest for people who live outside of East Baton Rouge if they want to see this in their community? And I know I'm asking you a question, it's probably its own presentation, its own conference, but can y'all give any words?
Well, you can reach out to Lysha, and you can reach out to myself and Lysha. We'll be more than happy to talk to any area that is considering to be able to utilize something similar to the Breaud Center for Hope. We know that for us, if you go to our website, there is a link that talks about the reports that we utilize to be able to fund this facility. There was an extensive year-long research that we did with the emergent method that talks about how to go about funding and what we needed. And based off of that report and that consultation, that's how we was led to the model that we wanted to use, which we didn't know existed until we realized RI was already doing it. So if you go to our webpage, our website, brbridge.org, you can find all of the resource material that we utilize to be able to start this facility up. And then I'm sure RI has some additional information on their website as well.
Yes, and I think just the short of that is just in your community, just talk to anybody that would listen, talk to your legislatures in your area, and just have the conversation about if you really feel that a facility like this one is needed in your area, just talk to the powers that be, and have these conversations about the need. And, we're already doing it in East Baton Rouge Parish, but we know that it's needed around the state.
And, with being in Louisiana, just don't give up, because we know we get told no first a lot. So you just keep going, because we were told no first when we tried to do this tax passage, and we just said, okay, let's check and adjust. And then we went back. So be persistent as well.
All right. Well, thank you all so much. This is some really good information. Thank you for the resources to be able to look at the information on your website. I'm not sure if your PowerPoint will be available for others to be able to look at. If it is, if you want to send it to me, we can send it out to others. Otherwise, they can just go to the website and get the information there, right?
Yes.
Thank
Yes.
you guys so much. We really appreciate you agreeing to do this. This is some really good information.
Thank you for having
Thank
us.
you guys for having us. All right. Have a good day.
Bye.
Bye-bye.
Everyone, our next session will start at 10:30, and it is youth advocacy, which I know will be a great session. So please stay tuned for our next session.
Somebody's unmuted.
Yeah, it's us. I'm trying to get her squared away.
Okay, just I heard whispering.
If y'all want to turn on, April, if y'all want to turn on your video and your mic just to make sure it works, that's fine.
Yeah, can you hear me?
Hey, we can hear y'all and see y'all. Very good.
Okay, I'm trying to block the, you know how they do the shadow in the back?
Yes, but I don't know how to do that. So that's why I just sit where I'm sitting in my house. So there's nothing else behind me.
Let me,
Someone else may be able to help you with that.
I have never been able to do virtual backgrounds either.
We have a question. Is it possible to obtain a copy of the agenda and the resources? So I will post a link. Well, Lillian has posted a link, but I'll also post a link in our comments. Either Lillian or I will do this. Comments on YouTube and within Zoom. And all of the PowerPoints and other items, we will send everything out at the end of the conference to anyone who's registered. So whatever resources we collect from the presenters, we will send that out to everyone.
Karlee.
Hi. Can you hear me and see me?
I can hear you and see you just fine. So we'll get started in about 10-ish minutes. Feel free to keep your camera on or off, whichever you prefer.
Thank you.
No. The ringer on my phone is music. It won't ring while you're talking.
Hi, everyone. We'll be starting in about 5 minutes with our next session, which is youth self-advocacy. Hi, Karlee.
Hi. How are you?
I'm good. How are you?
Good.
Glad you're on the panel. Hi, Devin.
Hello.
Glad you're on the panel.
Thank you for having me.
I can hear and see both of you well, so you're good.
Hey, Analiese.
Hello.
I think your camera is backwards.
Is it?
It's not showing me like myself, so I'm trying to figure it out.
Oh, we see you now.
Okay. Awesome.
It's nice to meet you. My name is Lillian, and I'll be helping moderate the panel.
Okay, awesome.
And we'll get started in about 3-ish minutes.
Okie dokie.
Hi, everyone. We'll start the session in just a second. If all of our panelists can turn on their cameras. Okay, I can see you all your beautiful smiling faces. I will hit the record button, and when I hit record, we will start the session. Okay, let's go. Hi, everyone. Welcome to the second session of the third day of the Governor's Office of Disability Affairs Conference. It is, this session is on youth advocacy, and Lillian Dejean will be the moderator for this session. And we really appreciate all of our youth who are participating in this panel, and I know everyone will enjoy it. So I will now turn it over to Lillian Dejean.
Hello, everyone. My name is Lillian Dejean, and I will be helping moderate the Youth Advocacy panel. I am so excited about this panel, and I'm so excited to see Analiese, Devin, Maddie, and Karlee here today because they're all wonderful, wonderful people. So without further ado, let's get started. So Karlee, would you like to introduce yourself first, maybe with your name, age, and a fun fact about yourself?
Sure. My name is Karlee Cowsar. I am 9 years old, and I am the youngest member of the Lafayette Acadiana chapter.
Thank you, Karlee. And I think it's way cool that you're the youngest member. Devin, would you like to go next?
Yes, my name is Devin Williams, and I am 23 years old, about to be 24 next month. And I am part of the Oklahoma Youth Leadership Forum, and I am a Partners graduate, and I'm a self-advocate.
Thank you, Devin. We're so excited to have you here. Maddie, what about you?
Hi, my name is Madeline Young. I am 14 years old, and I do pageants, and I also advocate for children with special needs.
Thank you so much. And last but not least, Analiese.
Hi, my name is Annalise Gaffey, and I'm 18, and I love doing everything in the outdoors and advocating for people with special needs that they can do anything they want.
Awesome, thank you. So now that we've all met our panelists, I think it's time to jump into the questions. As everyone can see, we have a range of ages, we have a lot of different people, but I think it's going to be really fun. So our first question is, what do you think is important for others, especially adults, to know about growing up with a disability? So Maddie, I'm going to pick on you first. Would you like to go?
What was the question again? I'm sorry.
No worries. So the question is, what do you think is important for others, especially adults, to understand or know about growing up with a disability?
I think they should know about our daily health needs and what we have to live with, and yeah.
I think that's a great point. Just because whenever your health needs aren't met, then it's hard to do anything else.
Right.
That's so important. Thank you for bringing that to our attention. Devin, you want to go next?
I can. What's important to know is what are our rights and to understand on if we have a voice in the matter and understanding on our own disability and what our strengths are and what we can accomplish through that and not doubting ourselves in the matter.
I love that, Devin. Thank you. I think as youth with disabilities, we're often doubted on our abilities, right? But we still have the ability to essentially prove them wrong. So Karlee, what about you?
I was basically gonna say what Devin was gonna say.
Awesome. Well, if you have any other thoughts, just feel free to just shout them out. And Analiese.
One thing I think is important, that everything should be accessible for us, but if it's not, it's important to realize that we know how to overcome and adapt to our issues and then make the best of what life offers.
That's such a great answer. And I think what's really interesting is a lot of our answers are kind of tying together to access to healthcare, knowing our rights, which is about access. And like Analiese was saying, just general access. So the right to live like anyone else. What are some of the challenging parts about growing up with a disability? Does anyone want to share?
I mean, the challenging part of it is like some like family members don't have, or any other businesses don't have wheelchair accessibility, and yeah.
Absolutely. Having others understand what your needs are in a non-judgmental way.
Right.
Karlee, do you have any input on what some of the challenging parts about having a disability is?
Well, there's a lot of challenging parts. Having a disability has a lot of pros and cons. I would have to say one of the most challenging parts is having teachers understand at school and such how the disability works and all that.
Thank you for that, Karlee. Devin, what do you think?
The challenging parts that having a disability is knowing what we need to say to people, like if we say the wrong thing, like if we need like accommodation in school or in public, if you're in a wheelchair, should someone speak for you, or should you speak? It's just having that voice in the matter of advocating.
Thank you, Devin. And Analiese?
I think some of the challenges would be having to talk for ourselves and explain what we need, and telling adults that they can see us as a normal person. You don't have to see the disability. It's important to realize that we do need special accommodations, but we should still be treated like any other person.
I totally agree with everything you guys said. Like I know Karlee said, there's a lot of pros and cons, which is also true, but communicating to adults, especially about your needs and how that doesn't make you abnormal or weird, it just kind of is. That's such an important part about growing up with a disability. So I appreciate everyone's answers because they're such great answers. And I want to take a moment to pause real quick because I did forget to mention to our audience to please send in any questions that they may want to ask our panelists either via Zoom chat or YouTube chat. Our staff here will filter through them and we may ask some of them during the session. So resuming with the questions.
Can I add on to that?
Pardon?
Can I add on to that?
Absolutely, please do.
And some people call us like lazy and can't and don't understand we may have learning disabilities, we may not, they need to see not the disability, the ability.
Absolutely. Devin, I see you nodding along to that. Do you want to expand on that a little bit?
Yes, I actually agree with that actually, because when it comes to with adults, they don't know like what our disability until we say something to them, and when we say it, they don't know like, oh, are you faking or are you trying to get out of it? No, it's in the gray area because we're scared. Like if we tell somebody, are they going to believe it or not? it depends on their mindset of the matter.
Absolutely. Does anyone else have any common, like, share experience with that?
I actually do. I have so many of them. Like, it's wild, and yeah. Someone, can I tell you a little bit about it, or just a quick story? They had a teacher that called me lazy at an IEP meeting, I think, and yeah. So, yeah.
I bet that didn't feel good at all.
No, it didn't. It really didn't feel good. So,
is there anything that you would wish for that teacher to know, like after she said that?
That you need to explain, like, define the word lazy. Not just say, oh, I'm lazy, and that's it.
Thank you. Karlee, I know you've had some experiences with teachers. Is there anything that you would want teachers to know about what it's like to have a disability?
Well, I think if anything, I would want teachers to know that we might, people with disabilities, they might, because sometimes people with disabilities, they try and figure things out. And every now and then people can come off a little bit lazy, but they're actually not. They're just trying to figure things out in their mind the way they were.
Thank you for that, Karlee. I think that's a really, really great point, that sometimes you try to like fly under the radar and not talk too much about disability to just try to get by, right? So you don't have to deal with other people and their reactions to you. Analiese, what about you? How has your experiences with school been?
Mine have honestly been pretty well, but I've always gone to a smaller school. So I've had the space to explain to my teachers what my disability was, what it included, and they were all very understanding. But part of it, you just have to have a voice and speak up about it. And a lot of teachers don't know about disability, so you do have to explain it in depth because they don't know about it.
That's such a great point that you make, that sometimes adults are the ones that don't know everything, right? And you have to be the one to speak up for yourself and kind of figure out how to explain it, which is a little silly considering the fact that they're the adults. So speaking about speaking up for yourself, our next question is, if you choose to, how do you talk to others about your disability?
I'll go first.
I'll go.
Sorry.
Okay. Karlee, do you want to go?
Well, telling people about what your disability is can sometimes be kind of silly. Well, I just tell them that having a disability has a lot of pros and cons again. And having a disability just makes people who they are. And we're just normal people.
Thank you, Karlee. That's such a fantastic answer. And Analiese, I'm really excited to hear about what you have to say too.
I personally choose to tell about my disability using my hobbies. because I can explain about it and how I choose to spend my free time and share about my disability. Because I can show what I can do, and then I can explain to someone what I can't do or how I can do it differently. To me, it opens up the door for conversation more than just coming out and talking just about my disability.
That's a great strategy and a great example. Would you mind telling us a little bit about your hobbies? I'd love to hear.
A lot of my hobbies include being outside. So I do fishing, hunting, I ride horses, I've done pageants, I've done it all, honestly. So it gives me a broad world to talk to anyone about anything. I do a little bit of everything.
Awesome, thank you. I want to take a moment to recognize some of the comments that are coming in. Lynette says, I love all that is being said, awesome. There is one person that says, I understand being scared to tell somebody due to the idea of it being that you're going to be judged. And you have no idea what you're going through. But you have to be strong and stand for what you believe in and what you know that you're capable of doing. And I think that speaks to what everyone here is saying today. You know, that fear of being judged once you tell someone, hey, I have this disability. It doesn't really define who I am, but I do have it. But there's still that fear of being judged. But I do want to go back to the question of, if you choose to, how do you talk to others about your disability? And I'd love to hear from either Devin or Maddie on this one.
I think you should sit down with the person and say, like, tell them what you have and tell them all about you. Just don't see, like I said earlier, see the ability, not the disability. And tell them, hey, I'm just like a normal person, but with something special, not special, but something like a disability. And tell them I could run. I can't run, but I could play baseball, or I could play all kinds of games, but in my wheelchair.
That's a great point. Sometimes you just have to adapt the way you do things. Devin, what about you?
From my experience, I learned, and I love what you said to adapting. That's just talk to them calmly, but only if you don't feel comfortable telling everybody, just tell the people that's in your circle. Because I met a student who was not comfortable telling his disability, but he told the people that he trusted because he had a bad experience. And I've been in this situation before on who do I tell? Like, if I tell them this, are they going to believe me or not? But don't hold it in too much, because if you do, then that's how trust issues happen. And it's better to tell people that will be on your side until the end. And I like how you guys always say adapting and looking on your ability and not the disability. The ability is more like your superpower. And I go for the hobbies too. That's the only way to explain people, like, tell my story, and I leave it at that.
I think that's a great point, that you don't necessarily have to tell everyone ever in your life if you don't want to. You can start small if you want, and it's really up to you how you want to approach things. I know whenever I was younger and I went to school, I didn't want to tell anyone about my disability. I didn't have my cannula at the time, so if I didn't say anything, no one knew. But I felt like other people would see me differently if they knew, and that was my choice. And I would tell a couple people that I trusted, and that's okay too. You know, that's the beauty of self-advocacy, is you get to decide for yourself. So we do have a question in the YouTube chat for us, which is, as you're learning to advocate or speak up for yourself, who is your greatest mentor or role model to help you learn how to advocate for yourself?
I can answer that a little bit.
Okay.
My greatest role model that I still look up to this day, and it will be my family, because my mother has really been fighting for me throughout the years and showing me that how I can speak up for myself. My older brother, who had autism, he'd been battling this for years, and he'd been advocating for himself. So I rely on my family because they've been a big mentor to me. But not only them, I met people throughout my years, and I attended a camp that showcased that I can advocate for myself. And it broke me out of my shell that I wouldn't be able to do stuff that I wasn't able to do as a kid. It showcased that I'm more capable, regardless of my disability, I'm more capable of doing the things I love to do and advocating for people that can't.
That's a great answer. I think you bring up a great point about different camps that kids with disabilities can go to. I went to a lot of camps whenever I was younger, and that was so important for me to know that I wasn't alone, right? So does anyone else want to share about maybe their role models or a camp that they went to?
Can I go?
Yeah, go ahead.
Definitely my parents, my mom, basically. Because she works in that setting. She works with children with special needs, and she advocates not only for me, but children with special needs. And the camp that I go to all, like, summer, not all summer long, but is Lions Camp. And I go with my best friend, one of my friends, and yeah.
Thank you for sharing that. Analiese, I saw you nodding along. Do you have any input?
I agree with Maddie on about the Louisiana Lions Camp, because it's here in Leesville and it's for children with disabilities. And I think it's great because kids can go and they can feel normal and they can do any activity they want, because there's fishing, archery, BBs, all sorts of fun games that they can play and be around children with disabilities similar to theirs.
Thank you. Karlee, do you have any friends or adults that you look up to?
Well, mostly I look up to my parents because they've been there for me these years, and they've been advocating for me, and now I kind of want to try and do a little bit of advocating for myself.
That's such a great answer. I 100% think that you're going to take over the world one day. So I do want to take a moment to pause and acknowledge a comment that we got in the YouTube chat that says all of you guys are awesome. And we also have another question in the Zoom chat, which is also about meeting people and potentially possibly telling them about your disability. So someone asks, when you meet new people, do you feel like you have to explain your disability, or do you let them ask as they get to know you better and figure out how you do things differently?
I will let them ask when the conversation gets started, because it's okay to tell them the disability, but it's better for them to get to know you. Then they're gonna have to question on what is your disability, or is there something that I should know about you that you won't tell anybody else? Because that's where the trust is being built, in getting to know someone new. Because I had to learn this the camp I went to is the Oklahoma Youth Leadership Forum. It taught me about that actually, on how to communicate with other people that have a disability or don't have a disability, and how to do it in a positive way and not a negative way. Because I've done that when I was little. I've done that. I really have done that. And going to this camp taught me the right way to really build the conversation up when you get to that topic.
Thank you. And you bring up such a great point about like negative advocacy and positive advocacy, because it can be so frustrating whenever you encounter someone who may not understand, may not want to understand, right? And you just want to live your life and keep going about your business. And that's really hard when you're facing negativity. So thank you for that. Does anyone else want to take a shot at the question?
I agree with Devin. I prefer to get to know people and let them ask the questions, and then they can see me how I live and what I do differently than them, and they can ask, and they can be curious and ask, what is the disability? How does it affect you? All that. And then I can explain. I don't prefer to come out straight out the gate, tell them about it, because sometimes that can almost scare people off because it's intimidating.
Absolutely. That's a great point. Sometimes disability is scary to people for some reason. Maddie, I saw you gearing up to answer. What do you want to say?
Yeah, I agree with Devin and Analiese, because some people like to come up and say, hey, why are you in a wheelchair? And all sorts of kind of questions.
Yeah, I remember whenever I was younger, I walked a bit funny. And kids would always ask me, why do you walk funny? But in my head, I was walking normally because that was just how I did things, and that I wasn't in any pain. I just walked that way. And it was like, what is wrong with you for questioning how I walk? Like, what's so special about how you walk, right?
Right.
So, yeah. Karlee, do you have any thoughts about this?
I agree with Devin and Annalise, and it is, I prefer to just let them come up and ask, because it builds up the trust. And
Well, thank you, Karlee. We appreciate your answer. And I would love to talk about what you're comfortable and uncomfortable discussing. Are there any things that you really just don't want to talk about whenever it comes to your disability, or things that you tell anyone on the street? What are your thoughts on that?
For my thoughts on that, actually, it's a 50-50 thing. If we don't know the person, because there's certain topics like disability, it's not really a bad topic to talk about if it's yours or somebody else, but if you don't know them, then that sometimes can be a touchy subject if they are basically coming at you at a negative way and not trying to get to understand you, why you're doing this. And that will lead to kids to go through depression, or it goes through heartbreak that I trusted this person and they betrayed me like that. At the same time, when they get to know you, certain topics are good when it gets to a friendly matter. But if it's not, it turns into a bad situation where you just want to be left alone and just be a shut-in.
Okay. So what I'm hearing from you is it's less about the topic or the thing and more about the person you're talking about it with.
Yes.
Does anyone share a similar experience? Or are there things that specifically that you'd want to talk about with people whenever it comes to your disability?
I'll go. It's like how do you use the bathroom? How do you get your wheelchair and all that type of stuff?
And it's funny because it's like, I feel like sometimes people ask like the least relevant questions ever. So it's like they ask about things that really just don't matter. And the great things doesn't affect anyone really.
Right.
Karlee, I see you smiling. What do you think about all this?
I totally agree with you. It just comes up.
Analiese, what about you? What are your thoughts?
I agree that there are some topics that like maybe you shouldn't ask, because if it were a normal person, you wouldn't ask that because it would be terrible to ask. But it also does come back to how they're asking it. What's their approach? Are they being rude? That's where I see it. Because if they're genuinely curious and want to know more about how to help you and build a relationship, friend with, like be friends with you, then it's okay. But if they're coming negatively, it's not.
That's a great point. Sometimes you get a vibe from people, right? Where it's like, you know, if they have good intentions and it's just a silly question, or if you're kind of getting bad vibes and you're like, hey, this is making me really uncomfortable. And it may not even be the question, but the way they're approaching it. And that kind of lends to one of our other questions is, what would prevent you from talking to others about your disability? So it seems like kind of those bad vibes is one of them. Are there anything else that you guys can think of?
If the person's acting creepy, or if they're gonna, I don't know, do something to harm you, anything like that, that would be a no-no. So.
Devin, I see you nodding along.
I actually agree with that, actually. Like, how they're going to approach on asking the question. Is it that you don't know, you're on your guard? And, like, are they going to ask me? Because my experience with that matter is I actually had certain, even as an adult, I had kids ask about my voice. And I'm like, okay, are they like curious about this or just trying to make fun of me? It's hard to like, are they being rude about it? It's like, how can we put that in a nice way? But it's like, I think it's hard to say, to be honest, of what response should you give to them.
Can I add onto that also?
Absolutely.
My dad, he's a law enforcement officer, and especially when I'm around him, he makes sure that I'm protected and safe before like anybody comes up and tries to do.
Thank you. You know, I think one thing, I know I've had this experience where I don't think a lot of people understand how much we have to talk about our disability, whether it's with doctors or with people who help us with supports or support workers, right? You have to talk about disability a lot in situations where you need to. So sometimes when, it's with, friends or people your age, maybe you just don't want to talk about it because you've already talked about it so much that it's like, I'm kind of tired of talking about this. Can we please talk about television or a video game that I've been playing recently? Because it can be tiring sometimes. Does anyone else have a similar experience to that?
Countless times, actually. Sometimes I'm just tired of talking about it. Just be like, can we talk about sports? Can we talk about video games? Can we talk about our favorite book? Or what's our favorite artist? or ban. It's like general topics.
Karlee, what about you? What do you think?
Well, it's like when you don't want to talk about something, I agree with them. You just try and change the subject. I just try and discreetly change the subject.
Analiese?
I totally agree.
Oh, sorry.
No, I'm sorry. You can go.
I just agree with what everyone said so far. But just sometimes you got to stop talking. Can't talk about it forever.
That's a great point. I mean, there's only so much you can talk about it. There's only so much to explain until it's like, we've gone over this, you guys. So we do have a question from YouTube from Stephen. I know some of you know him. And it's, what piece of advice would you give to your younger self? Or someone who is younger than you that's going through similar challenges?
I would say, I don't know what I would say to my younger self. I really don't know. That's a hard question.
It is.
I'm gonna let everybody else go, but I gotta think about it.
Okay.
I honestly think I'd tell my younger self, stop caring about the opinion of everyone else. Just live. Just enjoy what you're doing in life and have fun. Just stop caring. No one else's opinion really matters that much unless they're in your inner circle.
Absolutely. Thank you. And I think that speaks to what Devin was saying earlier about.
Yeah, I agree what you said. I would tell that to my younger self. Their opinions don't matter, only your opinion and your family. And don't give up on something you want to do and just try it out. If you don't like it, that's fine. But it's just learn to pick yourself back up and don't fall.
Can I add?
Yes, but before we do that, I do want to mention we have a comment in the YouTube that says, I love Maddie's reaction to Stephen asking a question.
I mean, I would say don't worry about the bullies. Don't worry about what anyone thinks. Just go with the flow and be your own self. Be who you were meant to be.
I love that. Thank you. Karlee, what about you? Do you have any thoughts?
I was basically going to say what Maddie just said.
She did say it really well.
Yeah.
So we do have a comment in the chat from General. Hello, Mission. That says, yes, Annalise, love this and wish I had known this many years ago. And then she also says, you all are fabulous with the hearts. I think the heart's really important. So our next question would be, let's pretend that someone would describe you to a friend. How would you want them to describe you?
I think they should describe me as a person who has a disability, who is unique, who has a disability but is able to do stuff like bathe, play sports, but in a wheelchair.
Thank you.
Could I add on to that? Could I add on to that?
Yes, please.
I think that what Maddie said is true, and also it's really good to we can all do stuff, and we're just normal people that need a little bit of help or equipment.
That's a great point. And I think that speaks to what a lot of you guys are saying. I hear a lot of, we're just normal people, right? We can still do things. I mean, we live normal lives. We may do things a little bit differently or have a couple extra machines or equipment, but really, we're not all that different. So Analiese or Devin, do you want to answer the question?
I think it's important for people to describe us like our personalities and everything like you would describe a normal person, but that we do have a disability, that we don't let it stop us, and it just changes how we do some things, but that it's not our entire personality. We're still like every other person that has a personality and hobbies and a life, that we're not just our disability.
Thank you. And Devin?
I actually agree with that. Actually, I agree with everybody that's on here. That we're normal people, and just for people to just describe us as who we are. Don't describe us of what we've been through, but just describe us on who we are, and we're human. Doesn't matter what I look like, as long as you see me as me, that's all it is.
It's fair. I mean, I would much rather someone describe me as, like Lillian who loves plants and books and cats than Lillian who's super disabled, right? Because I know that's a lot of people see me that way, but it's like, I am proud of having a disability, but that's not everything. Just like if someone else likes cats, that's not the whole part of their personality. So one thing that I know you guys mentioned were the camps that you guys went to and how it really helped you feel normal and just like everyone else. Maddie and Analiese, would you mind talking a little bit about the Lions camp?
You want to go, Analiese? You can go.
The Louisiana Lions Camp is a camp for children with many disabilities. They have camps ranging for people with physical disabilities, mental disabilities, diabetes, and a bunch of different camps for them. And they have all sorts of activities, including swimming, archery, BBs, fishing, all sorts of different things. And it makes children feel normal, and they're able to do activities that any other kid can enjoy. And they can also be around people their age. They can make friends with similar disabilities and grow from each other and learn.
They also have swimming, and they also have we go for the 4th of July, and they have this little dance that they do, that they put on for the 4th of July, where they pop fireworks, and they have this carnival where we get to have fun and do games and all kinds of sorts of stuff. And it also gave me a little independence for in the future.
What's the best part about Lions Camp for you guys?
To me, it's just being around with your friends. You can socialize with different people, and you get to do different activities that on a normal day-to-day basis you might never get to experience.
The best part about camp, it's free, and we get to be away from our parents. Sorry, Mom. But I like to have my free time and all. And it's just filled with love, and it's like people around you get to know what you're going, kind of know what you're going through, because they have disabilities just like you. So
Thank you for that explanation, you guys. And Karlee, I wanted to ask you, do you have any experiences where you've been around other people with disabilities and that made you feel good?
I have Bell Camp once a year for summer. I believe this year I didn't do it this year, but I've done it ever since kindergarten, since I was 5. It is very Bell Camp. They have like these classes like where the people with disabilities, they teach you to read Braille, they teach you to cook in the kitchen. And then after we do all our classes and everything for the day, we get to do like a fun activity like swimming, rock climbing, just stuff that normal people would do.
Well, thank you.
Kind of like what
Karlee.
Analiese says.
What's the best part about that for you?
Probably getting to hang around other people that have disabilities and that are my age.
It's such a great answer, Karlee. And I know we only have about 15 minutes left and we still have one last question, but Devin, I would really love to hear a little bit about your experiences with Oklahoma's YLF. So if you
I can explain. What Oklahoma Youth Leadership Forum is a camp that teaches kids that have a disability on how to advocate for themselves. The age range is 10, 11 through 12. We teach them how to advocate. We do a lot of good activities with them. We do the whole week in June. And we do it on a college campus. Even though we wish we could have done the activity that you guys can do, but we make up for that we teach them about the legislator and how the process of billing is, and they do a debate at our Capitol building here in Oklahoma. And we do etiquette dining, and we teach them how the right way to eat at a fancy restaurant. I love the speaker, she's amazing. And then afterwards, we do a dance with the kids. It's amazing how they all dress up and get ready to dance. A couple of years back, we actually started doing a talent show with the kids. And then what they are set out to do. And the best part of it is getting to meet new people and becoming a family with them afterwards.
I love that, Devin, and I've had the wonderful opportunity to attend Oklahoma's Youth Leadership Forum, and I feel like I've been adopted by you guys. So
yes,
y'all,
you have.
So I'm hearing a lot of stories about like dances and talent shows like that. So now I'm starting to think that we kind of miss an opportunity with the GODA conference by not doing the dance. I don't know about you guys, but that's how I'm feeling right now. So we have one last question before we close. And that's, what does your best life look like? So Analiese, I'm going to ask you to go first.
I think my best life would be accomplishing what I want to accomplish, finishing, going to college, getting a degree, and eventually just living a normal life like every other person.
Thank you, Annalise. Matt?
My best life would be walking across the stage when I get my high school diploma, which I have a good APE teacher. He pushes me to like my limits, and he kind of annoys me, but oh well. And I want to go into college and start my cosmetology. I want to open up a cosmetology business and to work harder, but I mean to work smarter and not harder. Well, and harder. So yeah.
That's such a great answer. Thank you, Maddie. Karlee, would you like to go next?
I was basically gonna say what Annalise said. I totally agree with her. Just want to go to college, get a college degree, and live a normal life.
Awesome. Thank you. And then Devin, last but not least.
For me is going back to school and finishing up my degree to be a special ed teacher, because I really want to showcase kids that how to live a normal life and how their disability is their strongest power that they have.
I love that. Thank you, Devin. I just want to point out some of the comments in the chat. Someone says that you guys will change the world with your stories. Keep speaking, keep advocating, and keep being you. And then our Louisiana Developmental Disabilities Council says, please continue to use your voices to advocate because your voice matters and is needed. So I think that's a great note to close on. I know we still have a couple minutes left, but there's a lot of questions in the chat that we could go through. I think everyone's enjoyed it so much that we could probably have 100 questions to answer if we really wanted to. But I just wanted to say thank you to our panelists because I think this was really great. And I think you guys are gonna do awesome things. So thank you for being a part of our panel.
Thank you for having us.
All right. Well, I will see you guys later.
Bye.
Take care.
Bye.
Thank you.
Bye.
Thank you, guys.
Hey, leave.
And everyone, we will have our next session at 12 o'clock. And it will be with our higher ed institutions that have programs for people with intellectual and developmental disabilities and autism. So please come back at noon and we'll look forward to seeing you all. panelists, if y'all want to turn on your cameras and your mic just to test them out.
Hi, baby. Hi, everybody.
Hello.
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 Johnny, Caroline, you want to test out your mic?
Can you hear
Hi.
me?
Can you hear me?
Yep, I can hear and see all of you guys, so we're good. Thank y'all for getting on.
Okay, so my webcam is at the bottom of my laptop, like right here. It's really awkward. I'm sorry. I have to like look at the bottom and it just feels weird, so.
We'll get started right at noon. So if you guys want to turn off your camera, finish your lunch or whatever, you can do that. And maybe about 11:58, we'll just come back on and get ready to go. Hi, everyone. If you would, the panelists, if you would turn on your cameras, we'll start the session in just a minute. Thank you all for being on. So panelists, we're live on YouTube, which that's streaming all day, and I'm gonna hit the record button as well in just a moment, and then we'll start from there. Hi, everyone, and welcome to our noon session of the third day of the Governor's Office of Disability Affairs Annual Conference. So far, we have had 10 incredible sessions, and this one will be no different. We thank everyone who is on, and we thank our panelists who are on, who I think we've had this session at all of our conferences because it is so important, and we've seen such progress in our post-secondary education opportunities for our students with intellectual and developmental disabilities and autism. And so we have made that a priority to get this information out to the public, and the people that you're about to hear from have done incredible work in moving the needle forward for more opportunities for students across the state. Dr. Melanie Washington with the Governor's Office of Disability Affairs will be facilitating this panel, and I will turn it over to her now. Dr. Washington.
Well, good afternoon. It's so good to see everybody's face here again. We have a few new faces, I believe. So welcome to the session on post-secondary education programs for students with disabilities. My name is Melanie Washington, as Bambi mentioned, and I am a staff in the Governor's Office of Disability Affairs. I'll be moderating the session today. I was going to briefly introduce the speakers, but I think I'll let everybody just do a brief introduction just to say your name, the program that you're representing, well, the institution, and then the program that you're representing at that institution. But before we get started, I just want to let attendees know that this is going to be a question and answer panel discussion. So I'll be asking the questions. And but please feel free to send your questions in. If any of the panelists feel the need to answer the question as they see it come up, they can feel free to do so, or we'll try to save some time at the end to make sure that we can address at least some of the questions. We have about 7 institutions represented here as soon as our last panelist joins us. And so we may not have a whole lot of time for extra questions, but please send them in as they come. All right, so we'll go ahead and get started with introductions, and I will start with the first person I see on the screen, Dr. Karlee Jurisich.
Hello, excuse me. My name is Karlee Jurisich. I am from the University of Louisiana at Lafayette, and I am the director of the UL Life program there.
Welcome, Dr. Jurisich. And next we have Dr. Mary Breaud.
Hello, good afternoon. My name is Dr. Mary Breaud. I am the faculty advisor for the Bridge to Independence program at Nichols State University, and also an associate professor in educational leadership at Nichols.
Welcome back, Dr. Breaud. And next we have Sue Killam.
Hi, everyone. My name is Sue Killam. I am a director at the Human Development Center, which is at LSU Halpin, New Orleans. And I am the director of a program called Paycheck, Post-Secondary Apprenticeship for Youth.
Welcome back. And next we have Johnny Manela.
Hi, good afternoon, everyone. My name is Johnny Manela. I am the director for the Program for Successful Employment at Baton Rouge Community College.
Welcome back. Mr. Manela. And next we have Lettie Goings. Now, I'm not sure if this is your first time here, but this is my first introduction to you. So welcome.
Thank you. Yes, this is my first time on this panel. I'm Lettie Goings. I'm a board certified behavior analyst at the McNeese Autism program. Our program is part of the graduate psychology department. So we don't have a post-secondary education program through the university, but my program is through the autism program, so the Bridges program. So basically we provide ABA treatment for individuals, and I take that and kind of run with it when they're at that age of transitioning into post-secondary education.
Okay, thank you very much. And next we have Eamon Halpin.
Hello, everyone. Sorry I can't get my video working, but I'm probably the newbie here. I work at LSUA. I'm a professor of English, and also I'm involved in campus administration. I'm Associate Vice Chancellor for Academic Affairs. But most relevant to this panel is that I'm chair of a campus committee charged with developing a program for students with developmental disabilities who've completed high school but are ineligible for regular college admission. So the reason we're doing this is we were approached from a couple of community members, parents of children who have developmental disabilities, and they sort of alerted us to the fact that there really isn't a post-secondary education option in central Louisiana for their children. So for the last year and a half, we've been kind of planning a program. We kind of agreed to undertake this. We've been preoccupied most recently with fundraising. I'm sure that's a topic that will be addressed during our discussion today. We've had some success, but we have a little ways to go. But I'm very glad to be part of the panel today.
Well, welcome. We're very happy to have you. So, as Mr. Halpin was saying, as he was talking, I thought this is really something that not too long ago was pretty much unheard of. So these programs are just really so interesting to have this opportunity for students to be able to attend college. And so we're going to go ahead and dive right in with our first question. Except that it says I'm being signed out. Hopefully that doesn't happen. I'm going to click this button and see. Okay. Sometimes Bambi and I are signed in on the same account. All right. So we'll dive in with the first question. Some of these questions will go around to each panelist, but all of them will not be addressed by each panelist in the interest of time. But the ones that apply to most of the programs, we'll go ahead and ask each panelist to answer. So our first question is, can you tell us a little bit about your program, specifically identify your program, which you just did, talk about its purpose and the services that are provided to the students. Okay, so we'll start with Dr. Jurisich.
Yes, okay, so as I mentioned, I'm with UL Life at the University of Louisiana at Lafayette, and we are housed under the College of Education, so we're considered an academic program there. Our program is 2 years with the potential of being 4 years for students who qualify for advanced through some advanced qualifications. So what our mission is in very basic terms is we want our students to have the same college experience that traditional students have. And when I say experience, I don't just mean in what they participate in, but really what they come to college for, which is to become a contributing member of society, find a career path, grow into themselves. All of those same things is what our goal is for our students. And we do that through our university courses. We do that through internships on campus. We do that through life skills courses. that really focus on some of those crucial life skills that all students need to know before entering the real world, not just our students. And then we put a large emphasis on community and campus involvement, because as many people know who have gone through college or university, that is where a lot of growth comes from too, not just in the classroom, but what they're doing outside of the classroom. And our students at all times are surrounded by college age peer mentors in everything they do. And so that also is, I consider that a service that greatly benefits their growth.
Yeah, absolutely. I could have used that life skills class. Dr. Beckers has joined us. So Dr. Beckers, if you'll introduce yourself and your program, and then you can answer, I'll repeat the question for you to answer.
Hi, sorry I was late. I was having internet issues. I'm Dr. Gerlinde Beckers. I'm an associate professor at Southeastern Louisiana University and the director of Lions Connected, which is a program similar to everyone else's, I'm sure, who've already introduced themselves. I also head up the Louisiana Alliance on Post-Secondary Inclusive Education, which everyone on this panel is very engaged in. So that is me. Sorry again that I was late. I live in the country, way out in the country.
Okay, so the question was, can you tell us a little bit about your program, specifically talk about its purpose and the services that are provided to the students?
Very similar to what Dr. Jurisich said, we offer a 2- and 4-year program. All of our students have up to this point enrolled in a 4-year program. We're starting our 6th year. We are a CTP, so we are certified. Therefore, our students are eligible for Pell funding if they are eligible, which is based on financial. Our program is very individualized. They choose their own courses as far as the courses they audit. We offer life skills. We offer social skills. We, prior to COVID and the pandemic, we are very engaged on campus. Their 2nd year, they participate in inclusive vocational opportunities, which is unpaid internships on campus. We work diligently with LRS to get continuation of services once they leave. Basically, their 4th year, we get employment, and then LRS helps them transition into community employment. We are in a rural setting. Most of our students come from the parishes that surround Hammond. And it's important that they're employed in their home-based communities because of transportation and for just the reason that that community piece is there.
All right, thank you very much. You've answered some of my other questions, but we'll move on to Sue. Sue, can you tell us about your program?
Sure. Is it okay if I share a screen?
Yes, you can. Let me make sure it's here.
You can share.
Okay.
I think you can hear me and then look at, do you see this? Is it on the right? I have 2 monitors, so can you see it?
Yes, we can see it.
So Paycheck is not a certified transition program, and it's deliberate. We seek to be a little bit different than those, and we value those as they're wonderful programs. My program was born out of the WIOA legislation signed by President Obama in 2014, and then kind of came to fruition. So we've been doing this program since 2016, so nearly 6 years, and we probably had close to 100 students involved in the program over that time. The program is a 3-semester, 12-month program. It is not necessarily at any particular post-secondary institution. We started our program at Delgado Community College, which is the local community college here in New Orleans. And now we've expanded. You can see we have the coursework can be taken at really anywhere, but we have put down the places where we have students that come from Tulane, Delgado, UNO, and Loyola. So it's a 3 semesters. So it's meant to be someone who's ready to kind of exit out of high school, who does not really want to continue on at university, or at least not probably get an associate's or a degree, a bachelor's degree. but who really is more interested in work, but kind of getting a few skills and some academics so that they can get better jobs. And so I have 2 transition specialists. I mean, our staff are housed at LSU Health. And so, you know, the Delgado doesn't have the program like Johnny's program when he describes it. It's from the community college. We just use the campus. The students don't stay overnight. It's not a residential program, but we focus on internships in the community. So all our skills are in the community. They do 2 skills training internships, and then they're placed into employment at the end of the 12 months. The admission criteria is pretty easy. It goes along with WIOA between 18 and 22, have a 504 plan or an IEP, and of course have LRS funding, because that funds our program. So I get fee for services for each student in my program, and we have to hit all those markers in order to get the funding that we need for our program and our staff.
Okay, thank you so much. You answered all the questions that I have. I know. So let's hear from Johnny.
Hi, everyone. Again, my name is Johnny Manela. I'm the director of the PSC program at Baton Rouge Community College. So our program is a little bit similar, obviously, to the others that have already spoken, and Sue's as well. We are a community college, so our program is limited to 2 years. So our students do not live on campus like they would at UL and some of the other 4-year schools. Our 2 years typically looks like this. Our first 2 semesters typically are life skills, where the students meet in one of our classrooms and learn a lot of different things, workplace readiness and so forth, obviously getting them ready for the workplace. We do not hire any of our students on campus. All of our students go immediately right out into the workforce, out into the community, potentially as soon as the 2nd semester, depending on how well they're doing, but typically the 3rd and 4th semesters when they're out. We strive for paid employment, which is our hope, because obviously what young person doesn't want to earn a paycheck, but there are some that are not willing to do that, or maybe we start off on a probationary period and then we work up to that. But we focus more on kind of medium to larger size organizations, typically that are community owned, so that there's a lot of opportunities. For instance, we're working with Our Lady of the Lake Regional Medical Center, and we will be, if all goes well, according to COVID, we will be working with them very closely at not only the facilities here, but potentially in some of the other areas. But our main goal is to get them to be more independent, less dependent on mom and dad and others, and to have them really speak out and have a voice.
Okay, great. Next, we'll have Dr. Breaud.
Hi, Dr. Mary Breaud. I am at Nichols State University. Our program is Bridge to Independence. We are going into our 6th year. We are a CTP, like some of the other programs here. I'm going to try not to duplicate. The difference for Bridge to some of these programs is that we have a 2-track program. We have our certificate track for students with intellectual disabilities who are working on a certificate of completion of our program. They are working on job readiness, independent living skills. They do the internships on campus, audit classes. They do have the opportunity to live on campus and campus housing. Our other pathway is our degree pathway, and that is for students with autism who are accepted to Nichols State University from their high school transcripts with their ACT score, etc. They are working on a degree of their choice. So any degree that is offered at Nichols, 2-year or 4-year or graduate degree. These students come in for tutoring, social skills, organizational skills on a daily basis. We've had some really great success in our certificate program. Our first cohort, we have some students that have gainful employment, paid employment, and are working in the same job. They just celebrated their 3-year anniversary in that same job. And this summer, we have our first baccalaureate graduate. We've had 2 associate graduates. This summer is our first bachelor's, and we expect to have 3 or 4 more of our students completing their bachelor's in the fall. And we have 10 students coming in for our certificate program in the fall and 41, so a total of 51 students for the fall.
That is amazing, Dr. Breaud.
Thank you.
Okay, Lettie, you want to go next?
Yeah, so I mentioned briefly previously, I might have given y'all too much information in my intro, but I mentioned that my program, the Bridges program, it's not affiliated through the university for university students. It is an actual targeted treatment group for social skills, and it's kind of evolved over the years. I think this is my 5th or 6th year running it, and we used to focus pretty heavily on social skills, but I noticed that the natural progression towards they're growing into young adults, social skills get a little more complex. So then you got to start working on job related social skills. And then are they going to get post-secondary education? Okay, so how are we going to prepare for that too? And the way my program is pretty different from these other programs you're talking about.
Did she cut out? Okay.
For ABA treatment. So I have kind of a time crunch that I'm working on. And I actually do have a patient on my caseload who is enrolled in a local community college right now. So that's exciting. And I'm kind of going through that journey kind of with them, you know, so it's pretty cool. Hopefully in the next, in the next few years, we'll McNeese could get a program very much similar to y'all's program. It would be very useful. I know that there's a lot of individuals in our community who could use that kind of support at this university level. My program was also really before COVID and before all the natural disasters we have endured. We went out in the community a lot as well. We would go on outings and we would practice the social skills that we would learn in the classroom setting, and we would put them to use out in the natural environment. So that was really fun and really cool. So that's kind of the overview of my Bridges program.
Okay, thank you so much. You cut out for about 10 seconds earlier, but I think we got the gist of what you were saying. Okay, so lastly, we have Dr. Halpin.
Well, as I mentioned earlier, our program is still in the planning stage, but we are hoping to launch it for fall 2022. It does have a name. It's called SPERO. It's an acronym, Special Program for the Enhancement of Resources and Opportunities for Young People with Developmental Disabilities. But SPERO also means I hope in Latin. We're planning for a 4-year program, and the program will share many of the features offered by the other 3 programs offered on 4-year college campuses south of the I-10. So the program will provide students with an opportunity to audit some appropriate freshman and sophomore level courses. There will also be life skills classes. Initially, we're going to base those on the program produced by the Council for Exceptional Children, but we hope to supplement that program with some ideas of our own. So students will have the opportunity to develop daily living skills, also social skills and interpersonal skills, and also we hope to help them acquire the vocational skills that will allow them ultimately to take up employment. There will be a student mentor aspect to the program. We will hire student mentors from the regular student body to provide support and assistance to the program students. Let's see. We hope to apply for the CTP designation during the first year. We want to get the program up and running. We're planning to start with 4 students and then double up, the following, add 4 students each additional year for a maximum of 16, we think. as I said, we hope to apply for the CTP designation during the first year, so that by the second year, students in the program will be able to use the Pell Grant to cover expenses. We do have a space. The university has been pretty supportive generally of this whole effort. We don't have a line in the budget yet. Maybe that'll come someday, but we do have a space, sort of a home, physical home for the program, which we're pretty excited about. I should mention as well, perhaps, that we had a couple of we've had a couple of open meetings where we've invited community members to come and indicate what they think the need is. And the initial meeting, it was back in December of 2019, actually, a small group attended, but a couple of those people actually became part of the committee. We invited them to join the committee that's been helping to develop the program. But August of last year, we had a second open meeting. We just did a press release, invited people from the community, parents, to come. And that second meeting, we filled an auditorium on the campus. We probably had about 70 people, moms and dads, grandparents, and some of the potential students themselves. So it was really after that meeting that we felt that this was something we should do and commit to. So that's our story.
Well, that's certainly interest, at least. Okay, so I think what I would like to do now is, you guys have mentioned the CTP quite a bit. Can somebody tell us what CTP is? And either of you can tell us, exactly what that means, and, why is it important to what you guys are doing?
I can do it if no one else wants to.
Okay.
CTP is a comprehensive transition program. It's an application that we've all had to submit with the U.S. Department of Education. And you basically have to outline what you're going to do. And a big part of it, I think it's like 75% of the time, has to be inclusive. And so you submit this application, which is pretty long, drawn out. And I know you have to submit evidence with syllabi and activities, and there's clock hours associated to it. And it goes through a process and either approved or not. And I know when we initially, Dr. Breaud can add in, it took, when I did it, and I did it like Dr. Halpin, we were in a program for a year, then we submitted. It took exactly 1 calendar year to get information back. Then they sent us the feedback and they gave us 3 weeks to amend the issues. And then we resubmitted, and then within 2 months we were approved. So that was our process. Now the CTP applications are going a lot quicker than they did originally. Something that recently has taken place is they're putting in accreditation standards. How that's going to impact us who are already CTP, I'm not sure, but kind of like with SACS and CAPE and all that, our universities go through accreditation. Now the programs are going to have accreditation standards.
Okay, thank you so much. So tied into that, and some of you have mentioned a few things, but I guess I wanted to be a little bit clear about the criteria. So what are the criteria? What are the criteria that students have to meet to be considered for your programs? And how do they apply for it? So let's start with Sue. And Sue, I know you said your program is not a CTP program.
Right. So, I think, as I said, when WIO was signed and we realized there would be this dedicated funding for transition for youth between 18 and 22 in the state, we began designing this program that would include some access to post-secondary education. So the students who were 18, who shouldn't be in high school anymore, needed to be out among people their own age and their peers. And then the focus is really employment. So that's why it's called Paycheck, right? I mean, we want the students and the parents to know that the 1 year will end in employment and a good placement. So, we've enjoyed for the last probably 3 years, when we had a larger group, we have 40 people in it this year and last year. So we're looking at a 75 to 80% placement rate. And, we do it all through Louisiana Rehab Services. So it's not a CTP because this wouldn't benefit these kids. These kids don't want to live away. They want to take some classes. They want to pretty quickly get into a paid internships. All our internships are paid. They're never on the campus. We never do classroom with them. They attend regular classes. They do it for credit. So they get a transcript. They can't apply that to an associate's degree because they haven't gone through, that application process. They're dually enrolled. So it's really for a different group of individuals who are looking for a different outcome. So it's not because I don't like CTPs. If I did it here, I'd have to have students here at LSU. So we wanted to use a community college. We also teach all the skills that most of the folks talked about, but we're in an urban area here. We have streetcars and we have buses that go nearly everywhere. So we get them from their house to the community college, from the community college to the community, from the community to their job, to their internships. And so we don't have the certification of the CTP program, and it's not for what we do. We do our monitor is Louisiana Rehabilitation Services and our outcomes. We can do the things we're supposed to do for Louisiana LRS, and then we have to know that we're getting the outcomes that we were hoping for, that the students will get into employment after going through each of these pre-ET services that are offered, and then be part of a college campus. So we get money from the schools for most of the kids. They pay the tuition for their students because they maintain their IEP. And so they pay the tuition and they pay for the books, supplies and fees, which can sometimes be as much as the course tuition. And so it's kind of joint funded. It really depends on a few partners. So it's not funded by Delgado at all. They are, I'm going to say, a silent partner, but we have verbal agreements with them, but we've never even done an interagency because they don't give us any money. We just use their facilities like everybody else as regular students.
Thank you. I was on mute. So the criteria for your students to be considered for the program. Let's go to Lettie.
Okay, so the criteria is going to be a little bit different. So like I mentioned earlier, the Bridges program that I run, we bill insurance for. So the criteria basically would be, are they between the ages 14 and 20? Do they have a diagnosis of autism? Because we require diagnosis. Insurance requires a diagnosis for them to get their treatment paid for. So do they have a diagnosis of autism and a prescription for services? And then, once we check off all those boxes, then we run our own assessments, social skills assessments, functional living skills assessments, and then we kind of gauge where they are. And then we just work off of a curriculum and we collect our data and we modify our programs and procedures as we monitor our data and our progress. And typically all of this occurs in the summer. So it's pretty intensive throughout the summer. And then we go from there.
Okay, thank you. Johnny?
Our program does have some specific requirements. As I think if you look at the other four-year schools, you'll kind of see the same thing, different age requirements. And I've got mine pulled up because I don't remember them all off the top of my head. But we look at students between the ages of 18 and 28. They need to have completed high school or GED or some sort of other training. They do have to be diagnosed, obviously, with autism or some form of intellectual disability. But we also want them to want this, because if the student is not really interested in this, which we have seen, then it's really not effective. The other thing that when we go through the interview process, is that we definitely make sure that the family support is there, whether that's mom and dad, grandma, grandpa, whoever that may be. Because I have seen, and I'm sure everybody else has seen, that mom, dad, whoever, whatever that family figure is, can be hovering a little bit. and is really, really surprised by what they can do. I've had many parents where I've had to just say, Mom, back off. And I'm a parent of a special needs child who finished our program, so I'm guilty of that just as much as the others. And parents are just shocked when they finish the program on how well they've done. And like, I never would have dreamed. And I said, I told you, you gotta let them loose. But a lot of it is based on them. They have to want it. We've had students that have applied, gone through the interview process, got to the first day and dropped out. They were not into it. Mom and dad were pushing them. So that's one of the things we really look for, is the desire from that student to be there. Because if it's not there, it's just not there. And sometimes we've had students that applied later and that desire was there and they've continued to be successful. Just have a recent success story. A young man finished our degree or our program in May, and he registered for 15 hours at BRCC, and he's going towards an automotive technology degree. So, you know, there are great success stories, not only with us, but I'm sure with others. So that determination, I think, has to be a major factor.
That is awesome. I love to hear those success stories. And when you talk about just that they have to want it, that's, you know, I think that is really important. I was a college advisor for a while, and it's interesting how students come in because, you know, they want to be a doctor because their parents want them to be a doctor and they can't pass any of their biology classes. So I'm interested to know, what do you do when you have students who are a student who is not really interested, but their parent is pushing them? How do you deal with that?
Well, we do talk with a lot of the parents and try to get a better understanding. And then of course, we sit down and really talk with the student and try to make some determination from there. And then we do offer them, you know, if they've been accepted, then, you know, maybe the fall is not the right thing right now. Maybe the spring is a better choice. And so we have done that where we said, let's wait a semester. It's only 4 or 5 months. The kid, you know, the students are young and that kind of thing. So sometimes we do that. And then sometimes they, you know, when that point rolls around, they're just not ready. This is just not what they want to do. So we do our best to try to help them and guide them. We have had students as well that this really wasn't the program for them. Either they were too high functioning. And I actually spoke with a parent about that yesterday and guided her to some other programs at BRCC. And then some who would probably struggle with the program that we're not really sure that would be terribly successful. And some we gear to other things like at LRS and that kind of thing. So we work closely with them as well, as I know the others do. But
So
we try to do what's best for them.
Good. Yeah. So you offer other options and resources. Okay. So Dr. Breaud, I know you said your program, you have 2 different tracks. So can you tell us the criteria for those?
Sure. So our certificate program is for students who have an intellectual disability. That is part of the CTP, which some talked about before. That's a requirement. And then for our degree seeking students, the requirement is for them to be admitted first to the university. And then they have to produce a, you know, evaluation for us identifying autism or ASD. So degree seeking, entrance into the university. Someone in the chat asked about, do they have to have TOPS? So it's the requirement of the university. However, admissions accept students. Doesn't necessarily have to be TOPS, but it just depends on what the university requires for admissions, because different universities require different things. But TOPS is not always a requirement. Someone also asked about Jumpstart. Jumpstart, to my knowledge, is more geared towards community college, but some students might have courses beyond Jumpstart that would meet college entrance requirements. So it's kind of a case-by-case basis. Back to the certificate program, students with intellectual disability, we have to document that from an evaluation. And then once that is done, typically parents bring those in or send those in, or individuals do. And after that, we will suggest a campus tour through admissions. And if the student displays some independent skills, some safety skills in unsupervised settings, then we will go ahead and schedule a interview with myself and the director to really meet and talk to the student, and like Johnny said, to make sure that this is what they want to do, because it is rigorous, and they have to be up for it. And we have an application for each. Did I lose you?
Oh no, we're here.
Sorry, my screen went blank. But we do have an application for each of our programs. So that is found on our webpage, on the university webpage. So you can just go to Nichols and search Bridge to Independence. And at the bottom of that page are 2 applications, one for the certificate program, one for the degree program. But we say don't fill that out yet because it's lengthy. And so let's make sure that the student meets the criteria of intellectual disability for certificate program, or autism for degree program, and we'll go from there step by step. We do accept 5 students in our certificate program every fall. It's a cohort, a 2-year cohort. And for our degree seeking students, we accept students as they are accepted to the university.
Okay, great. Thank you. Next, we will move to Dr. Beckers. The criteria for your program and how do they apply?
Okay, so we have pretty similar criteria, I think, across all of our programs. They apply online. We have our already for next academic year, I think we have 10 applicants, and I think all of our programs agree we get far more applicants than we can accept students. We accept 4 students a year. We try to keep 16 students maximum. Our criteria, 18 to 25 years of age, we do individual basis. Something we've learned, we cannot accept students with significant behavior problems. Minor behavior problems we can take, but significant we cannot. And we remind parents that we are a gift on our college campus and that we cannot have students who are, I hate to say the word, but runners, students who are non-compliant, students who show any type of aggressive behavior. So that's a big criteria. Independence as far as basic self-help, eating, toileting, those types of skills, basics, functional reading, math, we look at that. And I think as the other program stated, a desire to want to be on a college campus. We do have parents who want their students to be in a program when the students do not want to be in the program. So once the application deadline passes, we set up interviews. We interview all the students. We have certain questions with the scoring criteria, and this is stuff we've learned over our 5 years of doing this. And then we have 2 of our mentors, we do a male and a female, take the student on a campus tour, partly to show them the campus, but also to see how the applicants interact with peer mentors. Are they compliant? Are they interactive? Do they communicate? That type of thing. And a lot of times we learn that the students are a lot more at ease with the peers than they are during the interview process. And then when the student is gone, we talk with the parents. And then they come back and we basically go from there. And then, as unfortunate it is, we turn away a lot of students because we just don't have the room to have them in our program, and that's based on funding.
Okay, thank you. Dr. Halpin?
The audience for our program will be students between the ages of 18 and 28 who, 1, have an identified developmental or intellectual disability, 2, who have completed high school, either with the high school diploma or career diploma, certificate of achievement or some equivalent, and who are ineligible for regular college admission. So initially, the students will submit an online application, and then once we review the online applications, we will conduct interviews, one-on-one interviews with those students who meet the basic criteria. Another criteria is actually, Gerlinde mentioned it, that students not have a long-standing record of disruptive behavior. That is an important one. But we will interview the students who meet the basic criteria, and we are also thinking about, perhaps interviewing the parents as well. And I think our worry in all of this is, what do we tell the students who we can't admit? We've not started our program, so I don't know how that works. That must be quite difficult, I think, having to turn students away and disappoint them. So I'd be interested to hear how that aspect of the admission process is handled.
Okay. And then last but not least, Dr. Jurisich.
Yes. So very similar admission, as the other universities and college programs. When we do our application process, there is about a 30-page application. So like Dr. Breaud said, it's pretty intense. We really, and this year it'll be October 16th. So if you're interested, we do a preview day that we really encourage people to attend prior to applying. Just like Dr. Breaud said, so they know it's a place that they want to apply to. And that preview day is our entire university, but then when they break up into colleges and programs, that's when they come to the UL Life program for a couple hours. And we talk to the parents, guardians, and students, and then we separate them. It's a great day to kind of get a preview of the program and of the university as well. And then from the application process, we interview most people who apply. There are some that if we see like significant behavior, in the references, things like that, we might not interview those, but anyone who meets those basic criteria, the age, the intellectual disability, the completion of a high school program, Dr. Halpin said, not eligible for a degree seeking program, and behavior, they are interviewed. And then during the interview process, we interview parents, guardians, and students. We separate them. So we, talk to everyone in the beginning, but then we talk to parents, guardians, and the student goes and shadows a class. And during that shadow, they're being observed by our graduate assistants just to see, how they do. We expect students to be nervous. We expect them to, not necessarily be totally themselves, but it's a good snapshot of how the student will adapt to new people, new surroundings, because on a college campus, that's common. And then we talk to the student individually, and I find that that's really usually a great time for us to figure out the student's motives, because I agreed with everyone else that it is so important that the student wants to be there. The wonderful thing about so many of our students is they're honest. So we've had students say, I don't really want to go to college, but my mom wants me to, or my grandmother wants me to, or my dad wants me to. So that plays a factor into our decision, and then from there, we do admissions. We send out our acceptance letters. We typically have about a 25% acceptance rate. So same thing. That's why we love to see more programs in the state. Usually about 6 to 8 students each year. We're kind of in the process of growing our program. We currently have 22 for this fall, and it's looking like our sweet spot's going to be somewhere between 26 and 32 total, as we continue to grow our resources. And to kind of answer Dr. Halpin's question, as far as how we tell people no, I always say it's the worst part of the job, because we want there to be a spot for everyone. And we do so. For some of our students, we really encourage reapplication. Maybe they're really young, maybe they were so close. And we send out an official letter, but I typically reach out to those parents and guardians specifically and say, these are some things we observed during the interview process. These are some things we would love to see them continue to build and work on. you know, to try to give that encouragement. We're also always, you know, open to helping find other resources. I think Johnny mentions that, you know, this one might not be the right fit, just like UL is not necessarily the right fit for every college student. You know, while each program has a lot of similarities, while all the programs have a lot of similarities, each one is unique. And there's a right fit for everybody. It's definitely not one size fits all for sure. So we, you know, we encourage people to find, you know, what fits them. And like I said, we do give input and guidance as far as, you know, what are things that they could work on, improve upon, et cetera. And our admissions is typically, our application will be live, hopefully Friday, but August 1st. And then we are going to start interviews in November, probably through January. And we try to follow the same schedule as the university with our admissions being shared, our acceptances being shared by, at the latest, the end of March.
Some of these application processes are intense, 30 pages. But that's good, you know, for making sure that it's something that they want to do, and you all have all the information you need to be able to serve the populations that you serve. So I've heard you all talk about just kind of in bits and pieces about funding, and some of you have mentioned financial aid or a Pell Grant. Can we briefly run through each program and talk about how it's funded, and do students pay tuition, and if they're eligible for financial aid? All right, so we'll start with Sue. I know your program is different. I haven't figured out exactly everything yet. So we'll just start with you and tell us how it goes.
All right, so funding, I'll stay on that topic. So the funding for my program or for the students, either the school pays, the schools refer to us and LRS refers to us. So if the school refers to us and the person can be either re-enrolled or still has some time on that IEP, then the school system pays for their coursework and pays for their book supplies and fees. And so we feed them, they never go back to the school, but we keep their IEP active, and we provide attendance and progress reports and records to the school. If the student is referred directly from LRS, so it's a student that finished, they either went through the Jump Start or the April Done, you know, diploma, and then, or we have some people who got a diploma, made their way to Louisiana Rehab Services, wanted to go to a university or a community college and may have applied, and then they can come in the program and we do the same services. So Louisiana Rehab Services will pay for their tuition, their books, fees, and supplies, unless their parents make, and it's in the vicinity of, it depends on the number of people in a household, above $150,000 a year. So if that happens, then the student has to, of course, come up with the money, and they can apply, you know, for FAFSA and try to, you know, go through that process. So, you know, we don't have one entry into the program. It comes all over. So I don't have to say no hardly ever. I can take a lot of kids, and I can always hire more staff to provide the supports that we have. So that's a luxury I have. So anyway, that's the funding. It's really taken care of. We try to unburden the parents and even the stakeholder, but they're taking regular classes at a regular post-secondary education institution. And so, I mean, there's no one answer there.
So you're not a program where it's like, oh, we take about 5 students a semester.
We take about 30. We've taken, I have right now just under 40. I have 39 students. I have 20 new entries for the fall. A couple entered in the summer. So we'll be going full tilt on August 9th around that time with the community college and the other universities. And then we have a huge cohort, like 20 students that are doing their internships and are being placed, because we probably wouldn't add as many if it wasn't for that darn COVID that we all keep talking about. But you know, they weren't allowed to get out. Although I did 14 apprenticeships in essential worker positions for students who wanted to go to work as the pandemic was starting to it looked like there was light at the end of the tunnel. There were vaccines coming and things. So yeah, we kind of have a lot of things going on at once, a lot of plates in the air. And it's individualized, like we never have a classroom setting. We all do one-on-one supports. So, and we don't have an office. My staff have an office here at the university, but they don't have any place at the community college or at Loyola, or they just go to the Student Life Center. That's where they meet up and they do all their meetings. They arrange them through schedules.
Okay. Thank you. Now, Lettie, I know you said that you all bill insurance. Is that pretty much the gist of how payment happens?
Yeah, so we bill insurance for the service that we provide. Now, I will say we're going to start looking into some grants and sponsorships and stuff like that, because what I have found in my several years of working with teens and young adults on the spectrum, it gets harder to get insurance coverage for social skills and independent living skills, as some insurance companies like to say that those things aren't medically necessary. So they sometimes are not as likely to accept the request for authorization, which leaves us in a pickle with, oh, okay, well, now I have this 17-year-old who could really benefit from the social skills group and like really flourish. But now we got to figure out how to pay for it. And when you start talking about out-of-pocket costs, that really adds up. So for us, yes, it's a little bit different. We do bill insurance, but I think we're going to have to start looking more towards some funding from out in the community, maybe some sponsorships and stuff like that, just to make the program a little more accessible for everyone.
All right, so Johnny, Mr. Manela.
Yeah, so in the very end of last year, we also received our designation of CTP. I've had to put that off a little bit due to funding and staff sizing and a variety of other things. At this moment, the majority of our students are eligible for LRS, or Louisiana Rehabilitation Services. So if my memory serves me correctly, last semester about 77% of our students qualified due to various factors, and then the rest were all private pay. And I know in the fall, we have 7 private pay students. The rest will be LRS. We'll have a total of 34, if my memory serves me correctly. So that'll be the largest of private pay. As our program is getting more notoriety and expanding and so forth, we are getting more and more students that are eligible for LRS due to increases of family size and income levels and so forth. So that's where the majority of our funding comes from. I, like the others, are applying for grants and so forth, for scholarships, for supplies, for whatever. And then we do get a little tiny bit of funding from the college to kind of help us through. But I had also had a meeting with Senator Foyle last week, and Florida has done some interesting things. And I passed on that information to him. So he's going to be looking into that. That will not only help us, but help all of us potentially. And so he's looking into that to see if that could be something that could help us in the future. But again, for us, mostly LRS and private pay for now.
Okay. I wish we can get into what Foyle is working on, but we don't have time, but that might be a conversation for later. Dr. Breaud?
So funding for our program is basically for tuition and fees. And we do have a bridge fee that is additional. So students pay for the number of course hours if they are auditing courses in our certificate program, or if they are taking traditional courses in a degree program. So it depends on the number of course credits, as every university, I think, does that. So tuition and fees. Then there is a bridge fee of $2,055 per semester that we collect. That pretty much just pays for our staff. And students pay housing, the regular housing costs when they live on campus. We do have preferential housing placement for our students. We do place them in the different dorms on campus. They pay regular meal plans. And of course, if they are eligible for Pell through the CTP, that is a component of CTP. That's why CTP is so important, that students are able to tap into Pell. For our degree students, if they have TOPS, then that is something, scholarships also. Many of our students come with large scholarships. A lot of those are tied to ACT. And like Johnny said, LRS is a huge help to many, many of our students. And we do have a foundation account, which we do a lot of fundraising that I've learned a lot about fundraising since I've been with Bridge. So we do a lot of that too. But it's basically all of the fees, tuition and fees that you find on the university website, plus the additional Bridge fee.
So, Dr. Beckers.
Okay, so our Alliance Connected students pay right now a $3,000 program fee per semester. They're not charged any other fees. They're required to purchase their lunch, and they usually put we have a meal plan, which most universities do, and they put it on their ID cards. With their program fee, we have a textbook rental, so that includes all their textbook rental fees. If there are specific fees related to courses, like if they take a ceramic class, the parents are responsible for those types of consumable materials. If there's severe hardship, again, we work with a lot of rural areas and high poverty, we have paid for items, or the instructors of the courses have contributed materials if it's a big problem. The majority of our students are full Pell paying. And if they do not have LRS, that application process to get the parents involved, to get the students eligible for LRS, so that will help offset some of the fees if they need additional funding. And they actually, I learned this, transportation, they will help the parent, that will help with transportation to and from the program. We do not have dorm or residential part in our program. And we don't foresee that happening in the near future because Southeastern is known as a commuter college, and we're kind of going along those same lines as far as our program. The students, like I said, the majority are full Pell, which is why our CTP is critical, and the rest of them are typically full pay. As in our traditional Southeastern students, if the parents can't, if they are full pay, they can get on a payment plan just like traditional students. I think they pay a certain percent up front and then make a monthly payment. So that's how we function financially. And well, financially, we struggle, I think, as the other programs do. I have a foundations account. We do a lot of fundraising, and we actually raised enough money to start an endowment, which is protected money now, and hopefully over time it'll grow. Long term, it's going to be great, but short term, we struggle, year to year, like I believe the rest of our programs do, to keep the programs going.
Dr. Halpin, I know y'all are in progress.
Well, we plan to charge a semester program fee. It'll be somewhere between $3,000 and $3,500. As I mentioned earlier, we hope to, we plan to apply for the federal designation, the CTP designation, and that would allow students and their parents to, to pay for that fee through the Pell Grant money. We're kind of anticipating that by year 4 of the program, the revenue generated from the program fee would cover most, but probably not all of our expenses. Our difficulty over the last year has been getting startup funds, because before we even begin the program, we're going to have to hire somebody to help us run it, and we're going to have to, we also plan to hire student mentors. So there's that initial outlay of money. And last year I submitted, it was kind of during the COVID year, I submitted about 3 grant applications, and none of them were successful. I think in part that was because there were so many other needs during 2020, COVID related needs. So at the end of last year, we started our own fundraising campaign. We set up a giving option we have an LSUA foundation, and they have a website. We put a giving option on the website. We did some interviews, radio and TV interviews. Actually, Bambi came up to see us and we had a little reception. So she helped us get the word out. And that effort raised about $50,000, or has raised that amount so far. But this year I was more successful with the grant applications. We submitted one to Blue Cross Blue Shield, Louisiana Foundation, and they awarded us $126,000. So that's going to allow us to start. We're kind of confident now that we can actually launch the program in fall of 2022. And I have a few other grant applications in the works. And also our congressional representative, Julia Letlow, has kind of expressed an interest in what we're doing. She visited our campus recently and she was very interested in this program that we're developing, and I think she may help us secure some monies. So I think we were a little worried. We were quite worried last year, but we feel more confident now. And I think we've received a lot of support from the community, for the development of the program. So we're in a better place, we think.
Good. I hope the money starts flowing in.
Yeah.
All right, Dr. Jurisich.
Is it okay if I share my screen really fast? Okay. I was just thought that might be easier. So this is kind of an example cost breakdown for us. It's the same as any UL Lafayette student. It's based on the number of hours the student registers for. So we don't have an additional fee, but our life skills classes do count towards their hours. Students start with 12 hours, and then after their first semester are eligible for 15. Obviously, this can change and usually does based on the increases. I like to joke and say increases or decreases. However, tuition doesn't ever seem to decrease. Usually it's a slight change. Books, that can be anywhere from $100 to $300 or free. A lot of our instructors and professors for all students are getting creative and how to make it more affordable. And then our meal plans, this is the cost per semester. However, meal plans are completely optional for non-residential students, so students who aren't living on campus. And many of our students, even the ones, who are on campus for a full day, they bring their own lunch. They may go pick something up some days. And then our residential housing, it's the same cost as other students, and can range from $3,300 for shared suites to $4,800 for private suites. So there's no additional mentor fees, anything like that, or program fee. It is just all encompassed in that tuition and fees that the university, charges. And we are very lucky that, we have an administration that holds a lot of value in the program. And so they definitely help us financially cover, we don't quite break even, but that is our goal, as the other said, is to be completely, self-sufficient between tuition and, money from foundations, grants, things like that. And like Gerlinde said, our goal is an endowment in our foundation, so it can stay and be permanent and last forever.
Thank you very much to all of you for answering that question. And I know if parents or students have more questions about that, then they can look for that information on your websites, which
Sorry, and I forgot to say, our students the same are eligible for Pell Grants. Many of our students receive that, and then many of our students also receive LRS assistance. So I did want to mention that. Sorry, I didn't mean to interrupt you.
Oh, no, that's okay. I was just saying that, I know it's going to be hard to take in all this information and retain it, but this information probably is all available on your websites. Yes, okay. So now I want to get into just a little bit more specifically, ask a few questions about some of your programs. And so I want to start with Dr. Breaud. Dr. Breaud, what jobs are the graduates of the Bridge to Independence program employed in currently? What jobs are the graduates employed in?
For our certificate program graduates, like I said earlier, we have some that graduated in our very first cohort that are working in excess of 3 years at the same job. Those are governmental jobs, the clerk of court's office, the district attorney's office. We have had a student to work for the local police office. We have students who have been from away that loved the area and they moved to the area from where they were living previously in high school. So they've relocated and are living in apartments or houses. We have one student that actually bought a home and is living independently in her home, close enough to her job where she can walk to work. We have other students that do return to their hometowns, working in daycare centers. We have one student who is working in a company that rents out small equipment. So it's a variety of things, but many of our students, do have that gainful employment, and depending, some are 20 hours a week, some are 15, some are 30. We do have some students that are actually working a 40-hour week in daycares. So it's a variety of different things that go along with the internships that they complete on campus. And we're fortunate to have a daycare on campus, so they are able to get that experience if that's in their interest area.
Okay, thank you. Mr. Manela.
Yeah, so some of the employers that we currently have students working with, one of our largest ones is Vivid Ink and Graphics. And I typically do a lot of networking, to find different places. Working on an initiative with Associated Grocers. I had talked about earlier the Lake Hospital, working with them as well. Hopefully COVID doesn't ruin that for us. I did have a student who was very interested in working with a photographer. And I just kind of rolled my eyes to myself and thought that's going to be almost impossible. But we actually, through networking and knowing somebody, found a photographer that does a lot of mentoring. This is an unpaid internship. The student was thrilled to death. He's already doing a lot of photography on his own, but was very interested in learning from a professional photographer. So they have begun working together, doing weddings and so forth. So he's really interested in that. I mentioned Associated Grocers. We have several students that are working at a variety of those, and I'm working with their HR, their legal and marketing people to kind of broaden that out so that we can kind of look at that. YMCA is somebody that we're in discussion with, some of the local different YMCAs. And I also have been trying to make up some appointments with some of our largest law firms here in the area. And just kind of building from there. I don't do a lot of cold calling because I found that just doesn't help. But a lot of people have been touched in some form or fashion by special needs. I was able to connect with somebody whose son or daughter has an application for the spring, and then come to find out where she works, which is someplace I've been trying to find my way in. So it's just a lot of different places. You just never know, where they may be. And so we have a lot of students. COVID kind of hurt a lot of us, as I'm sure everybody else. A lot of students lost their jobs, my son being one of them. And so we tried to find jobs for them. Some we were successful at, some were not. So I'm concerned about the uptick in COVID at this point, as far as what our availability will be for jobs in the coming fall. But we continue to plug along.
Yeah, so much uncertainty with COVID. Dr. Beckers, what type of on-campus vocational opportunities do your students participate in? And how are those opportunities selected? You're still on mute.
We do a needs inventory with our students basically on what they want to do. Sometimes that's a trial and error, as we know in life. So once we start a job, we make our students stay in that job for that academic year. But then if we will reassess for a different job for the next year, we just don't want to leave our partners in a bad situation. So on campus, we have a Head Start program. So we utilize Head Start, and we also have a lab school. So we utilize the kindergarten. So our students who are interested in early childhood can do like the PK3 piece as well as the kindergarten piece. We have a rental bookstore and we have a retail bookstore. So if that merchandising is an area of interest, they can do that. Our students have worked, we had one student who did all of her on campus in our health unit on campus, and then she transitioned to employment in her community in a doctor's office. So all the years she was with us, she got the skills she needed. And by the time she left us, she was 100% independent on doing patient intake, which is what we strive to do. We have our newspaper, our student newspaper, our students who are interested in journalism, they've done their IVO with the newspaper. Coaching, we have a lot of our students are interested in coaching, and we have phenomenal coaches who will take our students and just nurture them. And that's been a really good experience. So pretty much whatever is opportunities we have on campus that align with the interest of our students in preparing them for employment once they leave us.
Good. All right, Dr. Jurisich. So what jobs are you preparing your students for after graduation? And are there some opportunities that they do as like internships as some of the other programs talked about?
Yes, exactly as the others said, we definitely don't have a one size fits all. We look at each student and what their goals are. I will say, sometimes with our students, there is a bit of readjusting we have to do in thinking when we have a student who may come in and say, well, I want to be a doctor. We always want to make sure our students are set up for goals for sure and strive towards goals, but we also want to make sure they're set up for success. So we do a lot in the first semester, first year of getting down to what they want to do and really the why. Why do they want to, if a student says, well, I want to be a doctor or a nurse, and maybe that's not necessarily something that's quite attainable at this point in their life. Okay, well, why? What about that appeals to you? And then from there, with the student, we, I say we don't want to change their mind. We just readjust. We say, okay, well, let's look at all of those things, all the opportunities that are available for someone who wants to help people, something of that sort. And we do an internship starting their second year. And we try to, we're currently slowly expanding to on and off campus internships. That was, I hate to be a broken record, but it was supposed to happen last year and it obviously did not with COVID. However, this fall, we should have a couple who are doing off-campus internships with partners in the community. And we hope that to expand because right now, while we do have a lot of opportunities, we are limited in some ways. If a student wants to work in a vet's office, UL does not necessarily have veterinary, opportunities on campus. So we want to make sure we place them somewhere that, they get that direct experience. However, if we are in a situation where there's not a perfect fit, we try to look for a placement on campus that has transferable skills. So are they going to be working on something or working in an area where when they put that on a resume, it is applicable to different jobs, especially for students who maybe don't know what they want to do. That's pretty common for a lot of college students. I mean, it's common for a lot of adults. So we want to make sure that the jobs and internships that they have, that are primarily on campus to have transferable skills. A lot of our students currently in the next year, we'll have students in the dining services doing food prep, the bookstores on campus in different areas, rec sports in different areas. We have a few sports managers, the daycare center. We have a student going to the library to work in the Louisiana history section. And, we hope to get him in the Science Museum or, one of the museums in Lafayette. And our internships are paid or unpaid. It just depends on the placement. So like a student who works in the daycare center, their interns are not paid in general across, campus. So those students are not paid. However, a student who works in rec sports, their student workers are paid. Therefore, our students are paid as well. So really, it just depends on the placement and what their protocol is, for all students.
Very good, thank you. It seems like the opportunities are, they're out there. They just need an opportunity to be able to explore it and be given a chance to be trained. And so these are all really, really great programs that you have going on. I think it probably opens up a lot of eyes to, to what can happen if people just are open to allowing students to be who they want to be. So we are running a little bit low on time. So I wanted to give everybody maybe a last word. Maybe I didn't ask a question that would give you an opportunity to talk about something you really wanted to share about your program. And then we can answer some of the questions that were in chat. So if anybody has anything else they'd like to share that they didn't have an opportunity to talk about, maybe you can have a minute to do that, and then we can address some questions. Was there anything else anybody want, Dr. Beckers?
I would like to just, I kind of mentioned it briefly before, and all the people on this panel are part of, it's LAPI, Louisiana Alliance on Post-Secondary Education. And we, I believe, I'm speaking for the people here, are very passionate about our programs and starting new programs across our state. And we're working hard we have next steps. Our next step is working with our legislator to try to get the funding that Florida has for their post-secondary programs on 2- and 4-year campuses. And I think that's something for the viewers to know, to get involved, to reach out to their alum, to know that in order for these types of programs to grow, it takes all of us. And LAPI is actually funded through the Developmental Disabilities Council. And I value the members on this panel because I think collectively, we're going to make a difference in our state. So again, just reach out to your legislators, to your alum, to your neighbor to say, hey, I want this at my school. I want this for my kid. I want this for my neighbor's kid. So that's it. Thanks.
Thank you. Was there any other thing anybody want an opportunity to share before we go to questions?
Well, I would like to share one thing, Melanie, and that is, we kind of jumped into this without knowing anything about it, other than what the parents were telling us. But I have really, I wanted to just say that I appreciate the support our program has received already from the directors of the other programs in the state. We really feel encouraged by Gerlinde and Carolyn and Mary, especially. They offer the programs on 4-year college campuses, and that has really kind of sustained us. And I just want to thank them for that.
Thank you. All right, let's look at the questions. Let's see what we have. Here we are. There's a lot of comments in here. And I'm sure I saw that some of you were answering some of the questions as we went. So I'll try not to duplicate that. What is the level of functionality looked at or required for a potential student? I think y'all talked about that. Also, what is the average age of these students? I heard a lot of you say 18, but what is the average age of the students in these programs?
I'll chime in there. Our certificate program, written in our CTP, is for our students to be aged 18 to 28. Our degree program can be students of any age. And I think one thing to really hone in on is that all of us that have a CTP, we have a written plan. And so that is what we have to live by, what we planned for and what we were allocated. So, sometimes there are students that don't qualify or fall within the parameters of our program, and we do refer them to other places, but it's it's what we wrote into our programs that we have to stand by, and each one of our programs wrote it a little differently. So that, and if you go to Think College, just Google Think College, and all of our programs are there, and you'll see if we are a CTP or not, and you'll see all of the programs throughout the country. So I know when we were writing our program proposal, that was very helpful to us to see the different options out there.
Okay.
For us, and just kind of glancing at the applications and so forth, I mean, we're probably looking 2021-ish, somewhere in that general range. We do have a few on the near 28, but probably more college age students.
So that's maybe the consensus. I have another question here that a few of you already answered, so I'll give the other panelists an opportunity to answer it. Besides the negative public attitudes, what have been the major barriers for DD students to enter and be successful in post-secondary education? And has post-secondary education prepared them well? And where does pre-eds fit in? I don't know if all that's like lumped together, or those are three completely separate questions. Who would like to answer that about the barriers to successful post-secondary ed?
I'll chime in. I kind of typed something up a little bit, but just to expand on that, you know, I think that because these programs are so new, and I always say, you know, universities and colleges in a lot of ways, they think in black and white, and these programs are like rainbow, purple, neon colored. We definitely don't necessarily fit in the mold that is there a lot of times for college programs on university and college campuses. That to me has been like the biggest barrier for our students, is sometimes things take time. So when a student or a parent and guardian comes to us and says, I'd really like my student to have, you know, this internship, and we agree, you know, that would be a great internship, or we really want them to have access to this on campus. We usually don't get a no from the university or from whoever's in charge of that. It just might take a minute for us to figure out how to make it work for all parties involved. So it's a lot of times the biggest barrier is logistics and having patience while we figure that out. And, you know, I think that post-secondary, you know, or secondary schools, you know, do a wonderful job preparing students. That's why we see such a high number of applicants. The biggest thing is, you know, self-advocacy. And I know Lettie talked about that in her research, you know, having the student really be able to advocate for themselves in situations where they are truly, you know, independent, and having to, you know, speak up for themselves about the supports they need or anything like that. And we've seen a shift in that. We've seen students come in with, you know, more self-advocacy skills than our earlier students. And I think it is because K through 12 teachers and supervisors and parents and families are thinking about college programs earlier. So they're starting to think about what happens when my student lives by themselves, more so than they were 5 years ago, because these programs were so few and far between.
Okay, thank you. Sue, you had your hand raised.
Well, to the part of the question that related to pre-eds, I actually think that some of these programs could actually think about being a pre-eds, like a vendor for LRS. I know Johnny does that in his program. And my program is based on that. It has the post-secondary academics as well, but a lot of those work-based learning, the counseling on enrollment, the job exploration, the things that are covered in the pre-eds, the stated pre-eds services that LRS provides, you could do that with some other staff and add to the complement. They'd be funded. So that's something to think about, because there's definitely independent living skills and instruction and self-advocacy. Those are two that you all are doing, and some of the others you're definitely doing with counseling on post-secondary ed. So that would actually bring in some funding to your programs. I mean, it completely funds my program. So there's no reason why you couldn't add it on. It would just be a complement to what you're doing.
And Dr. Beckers, Bambi asked the question, are there any schools in North Louisiana considering having programs such as these?
Right now, we're working with Grambling State University. Dr. Danielle Williams is very active. And then UL at Monroe, Dr. Anita Sharman is very interested and wanting to start a program. So we're working diligently with them and on their campuses to try to get these programs started. As Dr. Halpin said, it's not always an easy task. So it takes a lot of work and persuading. And it's kind of added on to the question Dr. Jurisich answered. I think a lot of it is the unknown that prohibits programs. It's not, they don't want to, they just don't know. And it takes us to advocate what a post-secondary program is and what's involved in our programs. So just kind of wanted to add that little piece to it as well.
All right, thank you so much for that. So we have about 2 minutes left. So I just want to thank you all again. I hope that the desire for these programs catch on for the rest of the state and across the nation. And if there are no more final comments, that concludes this session. It looks like Bambi may want to say something.
I want to say thank you guys. I appreciate your work, and we really appreciate everything that you're doing for our students across the state, and we're committed to help your programs grow and supporting the good work that you're doing. So thank you guys so much. And for all the attendees, we have our next session at 2 o'clock in 30 minutes. So stay tuned for another great session.
Thank you all. Bye.
Thank you.
Thank you.
Hi, Chuck. Welcome.
Hi, baby. How are you?
I'm good. How are you?
All right.
Good, good. So we can see you and hear you fine. So that's
good.
Great. And Yakima, if you want to test out your mic and video, you can do so now.
Okay.
How's that? Can you see me?
Yes, I can hear you fine. Thank you.
Okay, good. Hi, Chuck. Nice to meet you.
Hi. Good to meet you.
Good to meet you as well.
And so just so you know, your sessions, you'll start at 2 o'clock. I'll keep this, our schedule up on the screen until about 2 minutes to 2. And I'll just ask you guys to turn on your cameras and your mics, and then we'll get started exactly at 2 o'clock.
Okay, and then we'll share our slides. Okay.
Yeah, and I think Chuck will go first, so Chuck can share his, and then you can share yours, but y'all have access to that.
Okay. Do we go all the way, and because I'm gonna time myself too, but and turn that off. Are you are we allowing time for Q&A, or are you going to do what you've been doing before, like if people put questions in the I'm sorry, I'm going to go grab that, put questions in the chat, ask us going and interactively ask questions, or are you going to wait to the end? That's
up to you guys, however you want to handle it.
Okay.
So if y'all can hold our questions to the end, we can tell y'all, look, you have 5 minutes left, and you know, if that's how you want to do it, it's whatever method you want to use.
I would rather take questions all the way through.
Okay.
Good afternoon, everyone. This is Jamar Lanier, and so I'm just testing out the mic.
Hi, Jamar.
Good afternoon. Good afternoon, Chuck and Yakima.
Hey.
Hi. It's going to be a pleasure moderating and fielding questions for this important breakout session. So thank y'all again for participating.
Okay. I think that I want to go through my slides and take questions at the end. I think I want to do it, but if you find that there's like a really burning question, you don't want me to move on from whatever, it's okay if you interject and ask me.
No problem, and I'll do what you most feel comfortable with, and that's at the end, Mr. Chuck will like his all the way through, so we'll work with both of y'all on what y'all want to happen. So
okay.
And of course, if you want to take questions, just let me know throughout your presentation, so we can just get through and and I guess you'll notice some things with the flow and the vibe, and you may want to change up. So I'll be ready to do what you need.
Okay, sounds good to me.
Thank you guys for getting on early. I'll go ahead and shut off my video and camera, but if y'all need something, just let us know.
Okay, thank you.
Hey, Chuck, are you on?
Yeah.
What are your thoughts of OU coming to the SEC?
I can't decide.
Yeah.
I think it would be a good thing.
Yeah, it's definitely gonna if y'all beat LSU and the other like the Alabamas, y'all right in there for national title bid.
Yeah.
Since y'all tired of beating up on Big 12, and so
Yeah.
to make things interesting. So I wonder who's gonna get put in the West or the East. So I'm waiting to kind of see how that develops.
Yeah, me too. It will be interesting.
Yes, sir.
I know OSU is not happy.
Yeah, we know if we face y'all, we're gonna have to deal with a top tier quarterback.
Yeah.
That program has always had the best quarterbacks in senior college, man. It's just I don't know what it is, but it's just y'all put out some Heisman, and it's you're gonna have to deal with that.
Yeah. Yeah. I live in Norman, about a mile from the stadium.
Mm-hmm.
And one of my good friends played for OU
Mm-hmm.
way back.
Yeah, what year? What year was that?
75.
Oh wow, okay.
Yeah. Way back.
Heard that. And I watch Kyler Murray. I'm trying to get him on my fantasy team, man. He's right there in the top tier of the pros.
Yeah.
So we just Mike. I wasn't saying that just to be saying that, y'all. The quarterback play has been the thing to watch out there.
Yeah. Well, my friend went on to play for the Giants and for the Colts.
You said his name was Blake?
No. His name was Clyde Powell.
Okay. All right, I'm gonna look him up, see if I can Wikipedia, if he has a Wikipedia page. Good afternoon, everyone. We have 3 minutes until the next session starts. We'll get ready to present. So we look forward to having this go on scheduled on time.
Sounds good.
Hi, everyone. We will get started in less than a minute. I will, when I press the record button, that's when we'll begin. Hi, everyone.
Hello.
And welcome back. Welcome back to the Governor's Office of Disability Affairs Conference for our third day, fourth session. It's been a great conference so far. This session will be in regards to assistive technology. And Jamar Ennis, attorney and director Jamar Ennis, will be the facilitator for this session. So I will turn it over to him. Jamar.
Good afternoon, everyone, and thank you, Bambi. We'd like to welcome you to our session entitled Assistive Technology, which takes place from 2 o'clock to 3 o'clock. We'd like to go ahead and begin by introducing our panelists and presenters, Mr. Chuck Roberts and Yakima Black. We're going to start ladies first, as always, with Yakima Black, who is the president and CEO of Louisiana Assistive Technology Network, otherwise known as LATAN, which is the state assistive technology program for Louisiana and is funded by the Administration for Community Living, also known as ACL. Ms. Black has a master's degree in clinical rehabilitation and for 25 years has served as the chief executive officer of nonprofit organizations and has been a really good pillar in the community in providing and serving the needs. Ms. Black has also been a former GACTA member of our council. We encourage everyone to look at the link provided to get the full bio, and amongst the bios included is Mr. Black. Next, our next speaker, we have Mr. Chuck Roberts, who will go first on today's slate for the Assistive Technology portion. Mr. Chuck Roberts has a bachelor's degree in special education from the University of Oklahoma. Working as an advocate in the disability movement has given Chuck the opportunity to work with families and people with disabilities. Chuck lives by the motto, if you need a piece of assistive technology that does not exist, just build it. Chuck has coordinated registrations for the Oklahoma State Department of Education on the contract of Oklahoma Assistive Technology Center and has with the State of Department of Education. Chuck also serves as a family self-advocate Chuck also serves as family self-advocacy for several courses related to disabilities at the Health Science Center of the University of Oklahoma. Chuck also presents and serves as a self-advocate at numerous state conferences and lends himself to agencies needing consultations on disability issues. Chuck brings his experience of being the ninth child of 10 to his curriculum and presentations. This is my daughter Aria, who's participating in this conference, so she is excited to have Mr. Chuck Roberts with this presentation. So without further ado, Mr. Roberts, the floor is yours.
Thank you, Jamar. Let me share my screen. Hang on. All right. My name is Jeff. As he said, I am number 9 and Jinky. I have lots of nieces and nephews. I have about 35. So, and I also have cerebral palsy, but I guess I'm well known for my assistive technology. Because in my job, I work with OT and PT as they are becoming OT and PT. So they know me well. I want to tell you what we mean by AD. Anything that allows a person to be more independent in work or employment or just in their life. I could not live without AD. I live AD 24/7. And today I'm going to tell you about my health. I live in my own house, not a bond. I was fortunate to get my house. But as you can imagine, my house is filled with all kinds of assistive technology. My latest thing is I recently remodeled my front door. My brother is a carpenter, and one day he was watching me go out my front door, and he said, "Hey, Jeff, why don't we remodel the front door to make it more easy to get in and out?" I wanted to say about time. I've been saying that for 22 years, but I kept my mouth shut. But now my front door is easy for me to get in and out. And I do have an automatic door opener. Before I go on, I want to bring the light to them and they are high tech and low tech. And if you don't know high tech can do not be more high tech items like my gift or my band. Yeah. But my favorite is low tech. I am a low tech junkie. I like to make my own AD. And I live by the idea if you can think it, you can make it. So I make all kinds of stuff along with a friend of mine. And high tech are the buses, the van, anything that allows that normally cost money. But on the right, you can see my cell phone charging down that I made. And all it is a board with the USB plug mounted on the board. And I can slide the phone on the board and connect the USB charging. And again, I could not live without and this is my drinking straw. I like my Dr. Pepper. I can't live without my Dr. Pepper. So I came up with a long drinking straw. And all it is refrigerate tubing that carry water to your eye maker. And that's why I use you can buy what they call therapy drugs, but they cost more money. And I am cheap. I don't like to spend money. And this is my snack opener. I don't know if you can see that on top of the image. But it has a blade on it where I can drag it across the bag and open the bag by myself.
Chuck, this is Bambi. Can you put the your slide to full screen?
I'm blind. I forgot.
I think if you go to slide or okay. I think that's better.
How is that?
Is that better? Or maybe display settings. Go to the display settings at the top. And if you can make it the full.
I did.
Okay. I think that's good.
Is that better? I forgot to do that. I'm sorry.
No, that's fine.
I'm bad.
No, you're doing great. Thank you.
I'm going. This is my lounge chair where I lay on the back of my chair and watch TV. And you can see all my remotes on the back of my chair. And oh, this is my kitchen table. I took off the top and put blocks under the top, and that way it raised up the table for me to get my knees under. And again, my brother did that for me. Oh, this is my remote. I am the Velcro king. I like Velcro. I could not live without it. This is another device. This is how I pick up things that I drop from the floor. And what it is I just pen that I put down on the floor and keep my drop into the pen and put up on the couch and get it out. Because if I drop my glasses in the morning, I am a dead duck. I can't see a thing. This is my bed. Is the same height as my chair, and my brother built that because I will always move the bed, and I get my brother got tired of coming over and moving back. So he moved the bed to the pool, and that way it can't move. I don't know what I'll do if I ever buy a new carpet. But this is how I'm doing my dinner. My brain made that. And well, I keep putting my chair, and because I am a night owl, I stay up all night, and I get into bed by myself. By the way, I forgot to tell you that I do have a tender care. My aide come in twice a day and does whatever I need. And we lower my thermostat where I can have total control over my environment. And this is one of my attendants. He is getting me dressed. And I could not live without my attendant. Oh, I do have a DVD, but I don't think I have time enough to show it. But that was really quick. I normally do this in an hour, but now I would like to take questions. I answer any and all questions.
Great presentation, and we greatly appreciate your approach to assistive technology. We do have a few questions, particularly one question that is caught my attention is, have you ever thought about patenting some of your ideas?
Yes, but I like to tell people how to do things that they may need in their life. I think it is more important to share ideas rather than make a ton of money. Don't get me wrong, I like money, but ideas sharing is more important to me.
Thank you for your response, Mr. Chuck, and greatly appreciate clarity. And it was also asked if you can provide more of a detailed list of your inventions. But we have a question from the chat, and here's the response in the question. Thanks for sharing, Mr. Chuck. Glad to hear Assistive Technologies has made your quality of life so much better, and it has mine. Love your ingenuity too, but I must ask, how do you like your steak cooked?
I like medium rare. The pinker, the better.
I wholeheartedly agree with that sentiment. I'm a medium guy myself, but yeah, just the more you cook it, the more meat that you can appreciate. Okay, so another question we have is from the chat. Excuse my baby is she's hungry, so I got to go feed her soon. Is there a particular area that you feel we as professionals and self-advocates do not discuss in the realm of assistive technology?
That's a good question. Yes, I like to talk about personal care and how it's important, because if you think about it, we cannot live without personal care. And if anyone is interested, you can email me and I can tell you how I go to the bathroom, because it also entails assistive technology. And if I did not have that assistive technology, I could not live on my own, or I could not go to work. So, if you are interested, email me and I can tell you what I use and why I bring this up. And because personal care is why I lost my job at one time. They would not allow me to use my assistive technology, and it cost me my job. And that's why I bring it up.
Thank you for answering that important question. And last question that we have for you. Obviously, assistive technology has made an important has played an important part in the way you live, the way you do things. And the next question is, what is your favorite assistive technology, whether it be a device, application, and why is that particular device your favorite?
I tell people I don't have a favorite device because it depends what I am doing at that time. Because if I am opening a coat, I need that. If I am typing on my computer, I need that. So they are all my favorite when I need it. Does that make sense?
Absolutely. Echoing one of our responses that we received in the chat, I feel the same way. Our participant says, I feel like this is going to spark so much creativity in the disability community and help empower us to solve our own problems in a common sense, DIY way. Thank you for sharing your expertise, Mr. Roberts.
I'm glad I'm glad to do it. And you can always email me and we can talk.
Again, thank you for your awesome presentation, Mr. Roberts. We're going to shift more towards the public and nonprofit world, and we're going to shift towards expertise of Ms. Yakima Black, who is the CEO and president of Latam. We're going to hold her questions to the end. So, Yakima, the floor is yours.
Thank you, Jamar, and thank you, Chuck. I really enjoyed your presentation. You are quite the genius with your ingenuity in creating your own AT devices. Low cost. Thank you. I am going to see if I share my screen the correct way. Alrighty, how is that, you all? Am I sharing with you? Let's see.
Yes.
Okay, great.
We see your screen, and we also ask if you can maximize it to its full potential, if you can. Thanks.
Okay. I think that has to do with my view. If you will bear with me 1 second.
Yeah, I begin my fault. Will you get out of that? And I will take mine off.
Okay, thank you. This is Jamar. I am not really sure what is happening. Why I'm not able to do that. Let's see. Screen. How does the technology have problems?
I think that's a very interesting question that we can always discuss.
I find that we're the ones that will usually have the problem with the technology. Let's see. Jamar, I have no idea why it's in this particular mode. I'm going to stop sharing so that I can not see you all first. And maybe that's going to exit full screen.
Excuse me, someone actually put in the chat earlier that the F5 key starts presentation mode in PowerPoint.
Okay, let's see. Thank you. Is that Lillian?
Yes.
Thank you. Is that Shift F5, Control F5?
Yakima, if you started again, it was just the way that he had it, how he was viewing it.
Okay. Okay, you all, how was that?
Can't see it.
Share your screen.
When
That is so odd. I have my whole screen here and now you guys, you can't see it. Let's see.
Yakima, yesterday when I had to do this, I did share screen and then I had to get it into the presentation mode.
Okay. Let me see if I can get back to where I can see you all because I can't right now.
try that again because I got a month.
Can you all hear me?
Yes.
Yeah.
Can you see me?
Yeah.
Okay, I don't know why. Where did you go? Bambi, y'all, I may have to leave for a second and come back. I can't see, I am not able to see you all. I don't have my screen is up, but I am not able to see where the Zoom control bar, it's completely gone now. So I don't have anything I can't see where to share with you again. If that it doesn't make any sense.
Yakima, if you wanted to quickly email it to one of us and we could share it for you.
Okay, that works.
Thank you.
Okay, 1 second. And again?
You sent it, Yakima?
Just now.
Okay. If maybe you want to just start talking and as I get it, I will pull it up.
Okay. Let's see. Okay, you all, I am, send, okay. I am Yakima Black with, as we've said, Louisiana Assistive Technology Access Network, and Yes, this is one of these times where we are getting ready to demonstrate a device and something goes wrong. This worked 20 minutes ago, no problem. So I apologize and thank you for your patience. I'll start with, I thought I'd tell you all a little bit about who we are, because it's, as I've been with Latan for about 5 years next month in August, I am recognizing that there have been many changes, not just with the organization, but with partners and different folks that we, that Latan was familiar with over the years and worked with over the years, and folks have retired and changed, and it's necessary for us to reintroduce ourselves, if you will. Bambi, are you able to see this? Do you have the presentation?
Not yet.
Okay.
You sent it to me. I'm looking. As soon as I get it, I'll let you know.
Okay, let me open. Okay, so just a little bit of history. So based on federal legislation, LATAN, or the Louisiana Assistive Technology Access Network, was established as Louisiana's AT program in 1992. The program itself was one of the programs for the Louisiana Department of Health, and as I understand it, housed under the office, under the DD Council rather. And in 1994, LATAN was incorporated as a 501c3 nonprofit organization. So we are one of 8 nonprofit AT programs in the country, as well as one of 56 AT programs that are federally mandated and funded and monitored by the Administration for Community Living. Bambi, let me know, because I don't know what you can see yet. So
we can't see anything, it's just you. I haven't received your PowerPoint through email.
Okay, you said you are, you're not.
I have not. I can see you, but I haven't received your PowerPoint.
Okay, I'm gonna try to share it again and see what happens.
Yakima, I could begin to ask some of the questions that we received regarding
program. Okay. Well, I'm okay. I can see my screen. If I can go through the presentation.
I have it now.
Okay.
Okay, great.
Okay, Bambi, if you will, start on page 3.
Okay.
Or slide 3 rather. There we go. Thank you. Okay, it's as stated in the AT Act, disability is a natural part of the human experience and in no way diminishes the rights of individuals to live independently, to enjoy self-determination and make choices, to benefit from an education, to pursue meaningful careers, and to enjoy full inclusion and integration into the economic, political, social, and cultural mainstream of society. And we all believe that technology helps to make that possible. Next slide. The 21st century technology, or in the 21st century, assistive technology is where we all as AT providers in the country see things moving towards. And it's the recognition that older adults today are, and I'm calling older adults between the ages of 55 and 64, many of which have a developing disability or functional limitation. And Louisiana, over 40% of people ages 65 and older identify as having a disability or a functional limitation. In 2019, United States Senator Susan Collins, who's a Republican out of Maine, stated that advances in technology have been working to bridge the gap and improve function and activities of daily living, helping to manage multiple chronic conditions, reducing risk of hazards such as falls, and making homes for seniors safer. That while the early legislation that established AT programs mostly focused on people with disabilities, AT in the 21st century will obviously need to focus on the growing and diverse needs of older adults or seniors, many of whom we know are still working. Baby boomers are still working. And so in that regard, we're looking at AT on a broader perspective. So Latan's mission and who we serve, everyone in the state of Louisiana with a functional limitation or who has disabilities, and we help to achieve greater independence, whether it's at home, at work, or at school. We do cover the entire state of Louisiana, no matter where someone lives. And in a moment, I'll get into talking about some of those programs. Next slide, please. Our vision is to have a future in Louisiana in which individuals who use AT can achieve a greater level of independence, are more satisfied with their lives, and have greater access to their communities. That does include leisure and recreational activities. We strive to bring, we strive to bring that vision to fruition every day through our outreach in the community and within the services that we provide. Next slide, please. I'm going to skip this section because I think that Mr. Chuck did a good job of telling you what AT is. It does include software. It does include mounts that are used to house a particular speech generating device onto someone's wheelchair, and other types of equipment that is used to support AT, such as software. What's available? So AT awareness. So no matter what state you're in, or if you're in one of those 6 territories, part of the AT Act is to make people aware of what's available. Unless you're performing some of the activities that Chuck described a moment ago, where you are creating your own types of AT to assist, such as using a broom to help reach something that is too high on a shelf to knock it down to reach for it. There's reachers and grabbers now, but that ingenuity is how people began to look at technology to make things accessible to them. But overall, what we require to do as an AT program relative to awareness is to allow someone to try out a device, different types of devices through a demonstration in order to obtain hands-on experience with available technology. Those demonstrations occur for an individual or an AT user, their family members, couldn't be a personal care attendant, anyone, someone on the job. It could be a co-student at school. Anyone can participate in a demonstration to compare certain features of certain types of technologies, experience it for the first time, and more importantly, to make a decision about whether or not that particular device is going to work for you, or whether or not something else, a different type of device, will be more suitable for your needs. And the point to try it out is to be aware, but also to recognize what's there before making a costly purchase. Latan's new demo center showcases a diverse selection of AT equipment, over 600 devices, different types of devices, covering various types of functions, whether it's vision or hearing or communication. Some speech devices are there as well. We provide, while our demonstration center is here in Baton Rouge, as mentioned previously, we can go anywhere in the state to provide demonstrations on site. Can be at your home, in a facility, or at work, in a school, various settings. And since COVID, we now provide them virtually. And the only thing the caveat there is that virtual demonstrations, there's only certain types of device demonstrations that a user may benefit from. Ideally, you want to be able to touch, feel, turn it around, try it out. And sometimes demonstrations that are performed virtually are limiting in that aspect if you can't touch and feel that device firsthand. So ultimately, while we can, through a pandemic, provide a service to you virtually, we'd like to see it. The demonstrations are more beneficial in person. Next slide, please. Let's try it out. So we recognize again that the demonstrations cannot provide the same level of experience as an ability to see how that device or equipment will be used in that person's own environment. The device loan, it picks up where the demonstrations leave off. So when you make a decision that you've seen a device and you may like it, we allow you to borrow that device for up to 90 days to try it out before you buy it. This is really important because if, as my colleague presented a moment ago, stated, some devices can be costly, especially if they're more on the high-tech level. There's other things that you may want to know and try out, like what does it have? Does a particular device that you've seen on the market, is it easy to use? Are the instructions easy to follow? Are they easy to remember? Is it suitable for your particular home or the environment that you want to use it in? The device loan program allows you to try them out before deciding whether or not you want to permanently acquire the device itself. Next slide, please. So the types of devices that are available to borrow are all of the devices that are in our demo center. And as mentioned, some of them are mounts, different types of mounts, different types of hand switches or jelly switches to use. Whatever you see in the demo center is typically available to borrow, unless it's something like one of the reclining lifts that would be too heavy to move, or one of the major environmental controls that we can't ship or you can't come to our demo center and purchase. But there are areas such as communication and vision, small devices like the Glass Ouse or Candy HD, high definition magnifiers that allow someone to read their documents and that speak directly into their ears, or specialized keyboards that are ergonomically designed to assist with dexterity or limited fine motor skills. Travel scoots, and also many devices that assist with environmental controls, such as being able to turn your lights off and on. Or using, I mentioned here the Echo because it's one of the mainstream technologies that I think many people are using for convenience. But essentially, if you're controlling your room or the temperature of your room with your voice or your lights off and on, those types of devices are available for display, and many of which can be borrowed out of our demo center. Next slide, please. So access and acquisition. This is the next two required features that AT programs such as LATAN must offer. It is essentially, how do we get to a point where you can own your own AT, not borrow it for temporarily to try it out, but you've made a decision that you want it. One of the ways that we think is amazing, and I think it helps with federal funding, and it's one of the parts of the AT Act policy that Congress is able to appreciate and get behind because it saves individuals money. That is the reutilization program, where you're able to go onto Latan's AT Marketplace, which is a online database that allows the user to browse current inventory of the AT devices, and offers many different gently used devices that are just available for open-ended loans and available for free. So, and what we mean by open-ended is that you use it as long as you no longer need it. Use it until you no longer need it, or until you want something else, and then you return it back to us, and we then someone else can borrow it if there was only that one device available. Also, the marketplace allows for sellers to register and sell their gently used devices or equipment at a reduced cost. You will, if you see on our marketplace that there is an item and it has a price tag literally for sale, that means it's coming from a private individual who is selling maybe a modified vehicle that they no longer need onto the marketplace, and we allow people to do that. Sometimes people will just simply donate items to us, and we're able to refurbish them, say if it's a computer, and allow someone to use it for as long as they need it. And these devices also include software. Devices by category, I'm going to run through because I see that I am running out a little bit of time. They include daily living, hearing, vision, mobility, learning, speech, and communication. There is a web address there to get directly to the website, go to the AT Marketplace, or you can email at info@latan.org. Next slide. I'm going to run through these relatively quickly, but the next way that happens to be one of the programs that's within Latan's purview is the alternative financing programs. We have a cash loan program in our partnership with one of our banking institutions here in the state. And they're designed to assist people who may not be able to qualify for a traditional loan if you were just to go to the bank on your own. The cash loan allows for borrowing for the purchase of AT up to $50,000. And typically that's a high-end item. So we see cash loans request for home or vehicle modifications, or some expensive speech generating devices as well. We've had the cash loan program since 2001. Next slide, please. Some of the, I wanted to go into the socioeconomic barriers that many people with disabilities, they experience due to poverty, low incomes, or simply being inundated with monthly living expenses due to, associated costs to living with a disability. We've been able to expand our alternative financing programs to assist with some of these issues just to assist with that. I want to go through some of the, if I can quickly, working adults facing many challenges that are compounded by limited participation in the labor market. We know that 84% of households are considered, they don't have a bank or they're underbanked. So they may just simply use money orders, or they're getting their checks. They're able to cash them, but they're using money orders or payday loans, car title loans, all of those banking or financial options contribute to not having the best resources or creating to some economic barriers. Our alternative financing programs are designed to build credit to overcome some of those areas where we do not charge interest on some of the lease options. Next slide, please. On some of the lease options. Bambi, can you go back to maybe slide 13? I'm missing a slide on, there it is. The lease option is one of our zero interest programs that you may can do a short-term lease for up to 6 months when you need to maybe use equipment temporarily, like if someone is needing to travel, or just know that they're only going to need the particular equipment for a short period of time. That's available. A lease can be canceled at any time. There is no credit requirements. There is no information that requires, we don't make decisions as to whether or not you can lease a piece of equipment brand new based on your income or your credit history. We use information such as your proof of monthly income and your expenses in order to decide how you can comfortably make payments on those options. And then there's a lease to own option as well that allows you to buy something outright through programs. I want to say here that the lease to own option is one of the programs that many times people will purchase AT that is for a leisure or recreational activity that for sure insurance will not pay for, and they'll come through the lease program for that. And you can lease AT up to $20,000. Up to slide 15, I think, Bambi. Now we're here. The revolving loan fund is the newest program, and that is related to helping individuals build credit if they're experiencing some of these socioeconomic barriers that I mentioned a moment ago. It is attached with increasing your money management skills to increase access to mainstream technologies used in banking, that we allow for a financial management program to increase literacy for financial management, as well as the opportunity to prepare by purchasing devices needed for natural disasters. We use a sliding fee scale as well as the federal poverty level for households to establish a line of credit. And it's again designed to help AT users continuously have credit to purchase technology. So it works like a credit card. Is once you, if whatever your line of credit is, so if you receive $10,000 line of credit with us, but the device that you needed cost $3,000, you're paying it down, and as you're paying that amount down, the amount of money replenishes itself, and so you always have access to buy whatever you need through credit with Latan now. We do not make, again, it's designed to build wealth, build credit. So while we are using the credit that you establish with Latan to assist with making positive reporting to credit bureaus, we do not report negative entries to the credit bureau. So this is one of the programs that is about a year old, and we encourage everyone to take advantage of it. Next slide, please. Okay, I think we talked a little bit about increasing the digital divide. And that's just simply recognizing, we all found out last year that there were many people who didn't have access to computers or technology. We knew more so from our relationship with the Baton Rouge Parish Main Library that there are over 700 patrons per day that come into the main library just to use the computers and the internet. And the revolving loan program was designed to help with that. So as we prepare to go into hurricane season, the hotspots, tablets, solar charging for small devices can be obtained through this program as well, very specifically on a loaner type of option or lease to own. Next slide, please. Next slide, please. So we are Latan is a vendor for VR, and as well as a community choices waiver provider through the Office of Aging and Adult Services, as well as looking, and through that process, we integrate what we do normally with Latan. All our regular programs are built into those assessments that we provide. If there's a less expensive way to use technology, coupled with looking at a physical modification to your home, those are the types of recommendations that we make. We accept Medicare as well as some Medicaid programs. Next slide. Transition services, the only thing I'm going to say about that is that there are many people who are with schools and with transition services, because of some of the policies, some of those AT devices that are provided in the school systems cannot be taken home, though there are many policies that are trying to get to work around that. We are able to bridge a gap with possibly duplicating some of the AT that is used in the schools if kids need that same AT that is at home, as well as for children who are in LRS services and needing pre-employment AT that they're kind of in between stages and may or may not have access to the technology needed. We also assist with outpatient rehab when the AT that was used in rehab, folks need access to that type of AT once they leave and get back into their home. Next slide. Okay, next slide. Technical training and technical assistance. So we provide we provide technical training and technical assistance mostly on planning and setting up the environmental controls that are necessary for smart home technology. We conduct AT assessment in some schools who are not receiving it from our counterparts with AIM, as well as some complex technologies. We're allowed to allow some of the rehab facilities to do corporate loan devices with us for equipment that they may not need. Equipment that they absolutely need, but maybe that facility hasn't, they don't have it on hand. Like for instance, some of the complex technology that we have, we can loan it to some of the smaller rehab facilities to allow them to borrow it. Next slide. Bambi, in the sake of time, because I see there's questions coming up, I won't go all the way through this. You all can see that on the side. We do participate with MDAC and emergency response, and local providers to replace some of the DME lost and left behind after a natural disaster. And during the pandemic, there were several older adults and children with autism that benefited from borrowing some of our sensory pets to assist with the isolation and the loneliness with outside of their regular routine. Next slide. We are looking for currently looking for AT users, organizations that serve people with disabilities, to allow for regular use of certain devices to set up AT centers. And there's an open invitation right now for AT users to join LATAN's fiscal year 22 AT Advisory Council to assist us with strategic planning as well as quality improvement of LATAN services overall. And that's in a nutshell what the Advisory Council can do, but it's a little bit more than that. Next slide. Contact information. So if you're interested, or anyone you know may be interested in becoming one of our AT centers throughout the state, or to participate as an advisory council member, please contact me. And that's my information on the screen, as well as information about the marketplace. We're on social media. YouTube has a number of our demonstrations of devices that are, there's a number of videos on YouTube that for which we can show you what those devices look like. There's a blog, I think, on Facebook and also Instagram that will provide more information about LATAN services. And
thank you so
with
much.
that, thank you for your time, and I will entertain questions.
Thank you so much, Yakima, for that. Very informative. We have a great appreciation for what you do for our citizens who access to technology, especially when other companies and other means aren't available to. One question we had was from the chat. Question is framed as in the context of natural disasters. Much of my AT is useless without electricity. Is there a program that assists me to purchase and install a generator?
Not a large generator. Well, let me double back and say that. Yes, short answer, yes. The generators, as I appreciate it, can cost anywhere from $1,300 on up to $14,000 or $15,000. Those are large ticket devices, or large ticket, they're just large cost. And so one of the alternative financial programs, if you have a disability or live in a household with someone, your family member, yes, you can obtain one of the smaller solar charging stations that I mentioned earlier. They're between $300 to $500, or if it is a generator, can come through one of the alternative financing. Probably considering the cost would either be, well, I guess any of them. So depends on how much it costs. So the cash loan program could work for that, or the lease to own option, because it would not be a device that we would take in return. And I should have said that earlier. When we're helping AT users make a decision about which alternative financing program to take advantage of, it is usually thought in mind. Do we want, is it a personal hygiene type of item? We're not normally going to take that back. And so it would be a lease to own. Or if it's something like a generator that, you know, if you live in Louisiana, you're going to need it, that would be a lease to own option. And then, of course, the revolving loan program as well. So short answer, that was not a short answer, but yes. Long answer is yes. The alternative financing options, if you are an AT user, or if you have a person in your home who has a disability, though the generator can be purchased, considering life and death sort of situations, if you do not have the resources that you need. I mean, if you're out of, if you use life-sustaining technology.
Great response, great question. And I just want to encourage all our participants, reach out to me if you have any other questions, concerns with And also, Black is, of course, has been with our Cowsar Council, and we have an accessibility committee within the council. So of course, regular overlap there where we feature Latino. It's also very helpful with our agency area of resolving constituent concerns. So moving forward, if there's any questions, concerns that have not been answered, I would like to take them to.
Jamar, if I can add one last thing, I did not mention that for the last probably 15 or 20 years, Latan has, and the demo center was located at 3042 Old Forge. We will no longer be on Old Forge off of College Drive. We are moving into the demo center, which is located at 10988 North Harrells Ferry, North Harrells Ferry Road in Baton Rouge. And again, no matter where you live, we are able to travel to where you are to provide whatever resource, whatever resources that you need. There is a wealth of items that are currently on the AT Marketplace. If you do not see a device on the marketplace in a particular area that you need, I am encouraging you to call and ask, because we're in the process of uploading new devices onto the marketplace. And again, those items are free. We will also bring your devices to you and train you on how to use them. So, and that's before I'm gonna say you should probably take a look at the devices before I would make a purchase. I would probably check the marketplace to see if something is on there that you need. And it's everything from DME items. There are some that we keep aside specifically for emergency response, wheelchairs and walkers and rollators, but these are key items that you can find on the marketplace too. I think I saw a question that asked if the demo center is on the bus route. It is. I can't tell you what bus it is, but I do know that it's at the corner of Sherwood Forest and North Harrells Ferry. It's 10988 North Harrells Ferry Road. And we are still following COVID procedures. So while the demo center is open, please give us a call and set up an appointment for a demo. And we can, it's a large place, so we can serve up to 3 or 4 people at once from the same group. If you schedule with your family to come in for a tour.
Thank you very much for that information and that invitation. Certainly it is a great tutorial and a great thing to participate in. I've done it several times, and I encourage anyone who's in the market for assistive technology to take Ms. Black up on her offer. Okay, so we're going to have a 13-minute break between our next session, which is the FAIR program, and it will feature Ms. Libby Whiteside and Ms. Pat Holmes. So we'll be back in 12 minutes to begin the final session. Thank you.
Thank you all. Appreciate your time.
Hi, Libby and Pat. If y'all want to try out your video and mic. Hey, how are you?
I'm good. How are you?
Good, good.
Good.
Hey.
Hi, how are you? Did I hear Pat?
Yeah, that's Pat.
Okay.
Hey, Bambi.
Yeah, good. Okay, well, we can see you and hear you clearly. So we'll get, y'all have a PowerPoint?
We do. So
Okay.
I guess one of us can share our screen.
Well, yeah, so if you'd wait until right before, well, in about 8 minutes, I'll get y'all to turn on your cameras and we'll do an introduction and you can share your screen. If you want to try sharing your screen right now, you can do that just to make sure it works because we had a technology problem in the previous. It might be a good.
Yeah, good to practice. Pat, you okay with it if I'm the slide person?
Yeah.
Okay. All right. Let's see.
Pat, I think we met at that library in New Orleans last year, right before COVID. Were you there? Yeah.
At the housing, it was a disability housing conversation you guys were having. Yeah.
March 2nd last year. Remember the date well.
Are you guys able to see the PowerPoint?
Yeah.
But it's small.
Oh.
It's like rectangular. Oh, there it is. Yeah.
Bigger. Okay. Whatever you're doing, it's making it bigger. So,
is that big enough?
That's big enough, yeah.
Yeah, I think that's fine.
All right. And you can't see my notes or anything?
No.
Okay, cool.
All right. So yeah, I'll share the schedule again, and then in about 5 minutes you can share.
All right, sounds good. Thank you.
Hi, everyone. We'll be on in about 4 minutes. Hi, everyone. We'll be getting started in about a minute. Hi, everyone. Welcome to the final presentation of the third day of our conference. We are so glad to have our presentation on the FAIR program by Disability Rights Louisiana. And we have two presenters. And our first one, I'll introduce them briefly, and you can, of course, still go to the bio page to find out more information about the presenters. But they are Libby Whiteside. She's worked for Disability Rights Louisiana since 2012, after graduating from Loyola with a bachelor's in arts in sociology. She's certified by Virginia Commonwealth University as a community partner. Libby specializes in work incentives for job seekers with disabilities. And we have Pat Holmes, who holds a master's degree in economic theory and public policy from Levi Institute of Economics. He is certified by the Substance Abuse and Mental Health Services Administration, which we often call SAMHSA, to prepare Social Security disability applications for people who are chronically homeless and living with substance use disorders or mental illness. And without further ado, I will turn it over from our colleagues from Disability Rights Louisiana.
All right, can everybody see my screen?
Yes, ma'am.
Okay, thank you so much. Hi, everybody. It's really nice to be here with you this afternoon. Thanks for sticking it out with us today, spending your last hour of the day with us. I'm Libby, and today Pat and I just want to share with you what we've learned so far through our program and our work about the unique barriers that formerly incarcerated people with disabilities face when it comes to finding employment, achieving financial security, and really being able to remain and reintegrate into their communities. And we also want to share with you guys what we've learned through our work about strategies that have been helpful for our clients, in case any of those strategies might be helpful for any of you in whichever part of the state you're living in, or for any of those you're working with. So with that, I will pass it on to Pat.
Okay, and so I'll just briefly go over the Disability Rights Louisiana approach to helping individuals with disabilities live an integrated life in their communities, talk a little bit about the FAIR program, and then provide some statistics as it relates to why we decided to get into this work. And Libby will pick it up from there and talk more in detail about the FAIR program. All right, next slide. So Disability Rights Louisiana. These are a few priorities and services that Disability Rights Louisiana has historically provided for people with disabilities. So Disability Rights Louisiana, formerly known as the Advocacy Center, was established in Louisiana in 1977 as part of a national push for states to develop P&E networks, P&E protection and advocacy networks to protect, empower, and advocate for the rights of people living with disabilities and senior citizens so that they may sustain a fully integrated life in their communities. So how does FAIR build on this? Disability Rights Louisiana has historically served incarcerated folks with disabilities by providing legal services to those experiencing abuse and neglect in carceral facilities. FAIR builds on this by providing supports to formerly incarcerated people with disabilities through their reentry process so that they may find long-term stability post-release. And we just build on trying to break barriers and assist these clients in anything we can, which is why we say FAIR provides more holistic services, because we're truly about breaking down any barriers our clients may experience that stops them from living a fully integrated life in their communities. Next slide. Sorry about the noise. So financial access, inclusion, and resources are FAIR. It's a brief summary. So FAIR works to improve the employment and financial outcomes of formerly incarcerated people with disabilities by providing holistic financial coaching services and connecting them to community services needed to secure employment and achieve their long-term goals and stability. So how was FAIR started? FAIR was initially started as a 2-year pilot program that was funded primarily by the Kessler Foundation. This year, actually, just recently, FAIR was awarded a grant to sustain the program for the next 3 years by Baptist Community Ministries. We also have residual funders with the Rosemary Foundation, Greater New Orleans Foundation, and JP Morgan Chase. Next slide. So what's the prevalence of people with disabilities in incarceration? So approximately 1 in 3 Louisiana residents have a disability. That's roughly around 1.18 million people in the state. According to a study conducted by the Institute of Women and Ethnic Studies, just over 634,000 Louisiana residents have a mental health issue or a mental illness. And around 38% of those individuals with mental illness have directly or currently are being directly treated or provided services to stay and sustain themselves in their communities. That's roughly around 240,000 people. The issue is the incarcerated population is hidden from these statistics, which I'm sure would only increase the percentage of folks living in communities with mental health illness in Louisiana if we were to add those individuals to the stats. So nationally, people behind bars in state and federal prisons are nearly 3 times as likely to report having a disability as the non-incarcerated population. That number increases to 4 times as likely for folks in jails. So what does this mean for Louisiana. How does this correlate? Louisiana, as most of us may know already, has the highest incarceration rate in the country, with around 683 people per 100,000 residents in state custody. A major issue comes about when we start looking at the prevalence of disability in Louisiana facilities. A recent report that was done in between June 2020 and July 2021 by the Department of Medical and Mental Health found that if we just randomly selected a prison in Louisiana, on any given day, we may find between 59 to 95% of the population housed in the selected facility are on medication for an impairment. For example, the lowest medicated population was found to be in Allen Correctional Center at around 59% of that population being medicated for an impairment. The highest was LCIW at 95%. So if we pick the prison, it will most likely range within that threshold, essentially. And to add to this story, around 60% of the general prison population in DOC facilities have a substance use disorder. So what does this mean? This shows, like most states, jails and prisons are being converted to de facto mental health facilities where people with disabilities, human capital, their life skills, their talent, their employability are being diminished and their disabilities are amplified. This only exacerbates the pay gap between formerly incarcerated folks with disabilities and non-disabled workers due to the double stigma of having a criminal record and being disabled. Next slide. So, incarceration, disability, and employment and financial outcomes. So people typically are released from jail or prison with little money. They have little savings once they are released, but they also have a significant amount of criminal justice debt, which I term legal financial obligations. And we all know, despite the facts that studies show criminal justice debt is a barrier to reentry, most clients, especially the fair clients released to the Orleans, Jefferson area, they owe some form of debt post-release. And Libby will get a little bit more into detail about that once she starts to present. But I would like to add, Vera Institute of Justice, when they were just getting off the grounds here in New Orleans in 2007, they identified that 80% of the people housed in Orleans Parish Prison, the local jail here in New Orleans, were Black, and they were held there due to an inability to pay bail. So before the federal consent decree was established in New Orleans in July 24, 2012, the courts, traffic and municipal as well as criminal court, were operating with partiality as they used financial assessments to fund court operations, which inherently created a conflict of interest, which also violates the thought that judges operate impartial courthouses, which they are supposed to do, as we know. Okay, so 1 in 5 people with disabilities in urban America and 1 in 4 in rural areas, regardless of their criminal record, are impoverished. And this was shown by an annual disability statistics compendium that is usually done by the University of New Hampshire. So here I just wanted to stress the social inequities have compounding effects as it relates to the intersection of race, disability, and incarceration, but specifically focusing on race here. Around 13.3% of the general Black population has a disability, compared to around 10.4% rate of disability for all other ethnic groups combined. So to put this in perspective, Blacks with disabilities are 29% less likely to be employed, 32% more likely to experience poverty, and nearly 38% more likely to lack adequate housing. And this statistics matter greatly for the FAIR program because around 89% of our clients are Black and they experience most of these issues. They're coming to us in poverty. They have a disability, first off. They're coming to us in poverty and they also lack adequate housing. Most of them come to us doubled up in homes with family members, and housing is a major concern for them. So I just wanted to add that because it's definitely something that we have been seeing with our client population. It was also identified in the annual disability statistics compendium, the 2020 report, that Louisiana has the 8th lowest employment rate for folks with disabilities at around 35%. Meanwhile, Louisiana is ranked 50th in crime and corrections, 48th in education and opportunity, and 46th in healthcare. If we are to level the playing field for formerly incarcerated people with disabilities returning to their communities, we have to center our discussions around disability inclusion as it relates to equity building and labor market objectives and outcomes for this population. So I fully agree with the state as model employer, the same task force that was developed here in Louisiana in 2018. I think that that's a great start, but I don't think that that's where we should finish. This is a time to show the public employment. This is a time to show that public employment options for folks with disabilities as an employee safety net when a private labor market shows slack can increase labor market outcomes and thus financial stability for people with disabilities and also for the population we serve, the formerly incarcerated population with disabilities. It would also support state and local budgets by increasing a taxable base that they have to build revenues off of. And so I think that this is just an overall equity conversation that needs to be had in policy, because it's a win-win if we are to establish something like this that allows the folks with disabilities, when the labor market, the private labor market is slacking, to find public related jobs and continue to work and sustain themselves in their communities. Next slide. So, an uneven playing field. As a group, workers with disabilities on average earn around 87 cents for every dollar earned by a non-disabled worker. And we can see here the pay gap widens with educational attainment. So as you can see, high school diplomas, people with disabilities are fairly close in regards to earnings to those without. But as we move up, that gap continues to widen until we get to master's degree or higher, where we see a huge gap in between folks who have a disability and their earnings and folks without a disability and their earnings. And so this is where we need to start having a conversation around equity. So there have been efforts to push more equity-focused policy in the hiring process, especially as it relates to big corporations adopting environmental, social, and governance strategies to involve disability inclusion as a priority. And I think that's essential because there is a lot of ability in disability, and the private market needs to be able to adopt objectives and policy around disability awareness, that the human talent and thus the human capital of disabled folks are able to be realized broadly within the labor market. Also, as we can see here, the U.S. economy would have received an additional $141 billion boost. That's roughly around 1% of GDP in 2011, if people with disabilities were paid comparatively to those without a disability. Also, their pay was equal for folks with disabilities. It would have translated to a net increase in federal taxes of $25 billion and a net increase in state taxes of around $6.5 billion. Also, folks with disabilities represent a sizable consumer base. Their after-tax disposable income is around $490 billion, according to the American Institute of Research, which will only increase if equal pay was part of businesses' hiring strategies. Next slide. Here we can see how the uneven playing field works for people who are formerly incarcerated. Speaking in regards of total aggregate annual earning loss, there is a $372.3 billion loss in earnings annually for folks who are formerly incarcerated. This matters a great deal because, like the disability community, this is a sizable tax base that could help state and local budgets. And I think it's something that should definitely be considered in hiring policy, because it represents a huge shift in how state and local governments can boost their budgetary outcomes. So in the next slide, I would like to address typical barriers to a successful reentry our clients face. Next slide. So typical barriers we see from our clients coming home from incarceration. There's a limited social support typically for our clients, limited income for basic necessities. Most of our clients come home without any health care coverage and concerns about their health. Another issue that is not ultimately immediately a concern is the debt, but it is something that Libby and I are fully aware of. And so this is something that we initially jump on top of when doing baselines with our clients. It's trying to figure out if they have any legal financial obligations or criminal debt out there that is, against them that could potentially harm them in the near future. They have legal concerns as well as limited education and technological proficiency. In regards to technological proficiency, I think this is something that we need to focus the attention on VR services, because it's identified by the National Employment Team, which is consisting of around 78 VR agencies nationwide, that within the next 5 years, around 73% of jobs will have some type of digital component to it. And if we want to boost the labor market outcomes for folks with disabilities coming home from prison, and also just folks with disabilities in general, I think we have to start talking about what it means to be technologically proficient and how we assist these individuals in getting to that point. Another huge barrier that we see here that's not on this list that I would like to add is housing. Housing is probably the #1 barrier our clients experience coming home. Like I mentioned, most are doubled up with family for a finite period of time, and it's just really insecure for them. And so we have tried to address this with helping clients access shelters and also filling out permanent supportive housing applications. But from my realization and studying and looking into non-elderly disabled housing options in the greater New Orleans area, there's just not enough. And I think policy pretty much has to focus on how do we boost non-elderly disabled housing, because we do in the greater New Orleans area have a fair amount of veterans as well as elderly related housing, but not much of non-elderly disabled housing. So I think that that's a focus for policy for sure in the near future. Next slide. And the coaching approach. So I would like to just talk a little briefly about the coaching approach, and Libby will pretty much pick up from here and explain how the FAIR program deals with coaching its clients around financial stability and helping its clients with the reentry process. So as a financial coach, we typically meet clients where they're at, which is also something that counselors do. But to add to that, we typically allow our clients to be in the driver's seat. They're the ones that are in charge of how we decide to go about our meetings. Because as a coach, we're pretty much concentrating our efforts on assisting clients in identifying their values and assisting them in creating goals that are passionately held, so that they feel passionate about the goals that they set and ultimately are able to succeed in meeting those goals. Also, as coaches, we focus on the now and a what's next. We don't like to focus on the past, but how do we help clients move forward? And we do this by assisting clients in finding stability. The FAIR case managers are action-oriented, as we provide our clients with a problem-solving skills and information to adapt to their unique situations. And what this essentially means is, as financial coaches, we must remain flexible when assisting clients. And that happens by helping them identify values. And then once we do help them identify values, identify those goals that are strengths-based. And what do I mean by strengths-based? That means helping clients figure out goals that themselves can accomplish with their social and physical assets that they have at the ready. And these are also forward-thinking goals, meaning that they're focused on what's next, what's to come in the future, not about what happened in the past and how to resolve that. Lastly, we prioritize and strategize. So help clients then prioritize their goals through building action plans, and then build step-by-step processes that allow us to meet those goals. And with that, I will allow Libby to finish off the presentation and talk a little bit more in detail about what FAIR does specifically.
All right, thank you, Pat. So before I dive into how we operate and how we are trying to go about improving outcomes for this population, first I want to tell you a little bit about exactly who we're working with. So on this slide, you can see our eligibility guidelines for the FAIR program. First, our clients must have a disability. So every FAIR client has a disability, but over 80% of them have multiple disabilities. About 2/3 have serious mental illness, about 30% have physical impairments, and about 20% have cognitive disabilities. Next, our clients must have been incarcerated within the last 10 years. Over 2/3 of our clients come to us within the first year of their release. And some of our clients have spent just 4 months in a local jail, while others have spent up to 43 years in prison. And the average length of incarceration for our clients is 10 years. So I think it's really important to reflect on exactly what this means. When someone's incarcerated for just a month or more, it can have catastrophic impacts on someone's life. You know, they lose their job, they can lose their apartment, they can lose any benefits they might have had, they can, their cell phone bill stops being paid, they could lose custody of their children, their medical treatment likely will change or could stop. And that is where people are at when we meet them usually. And now just imagine what it's like to be facing all of those barriers just mentioned coming home, but for someone who's been in prison for years. Just kind of imagine what kind of impact that would have on your relationships, on opportunities to save money for your retirement, opportunities to support your family members or pursue an education. And then think about how fast the world moves. For our clients who were incarcerated, starting in the early 2000s or before that, that was the world before smartphones. And so these are the kinds of things we just need to be aware of when we start working with somebody who's experienced incarceration. Next, all of our clients live in Orleans or Jefferson Parish. All of our clients want to work, and this is a really important aspect of our eligibility and leads to some really important conversations with prospective clients or community partners who make referrals to us, because often someone will say, yeah, I would love to work, but I can't. And when we do digging into what the reason is for why do you say you can't work, there are often concerns that are raised that do have potential solutions that we could potentially try to work through with those clients. For example, if someone says, oh, well, I got injured recently and I can't work because nobody will hire me if I can't stand all day long. That's something that could be, there's a potential solution for that with reasonable accommodations or possibly training for another line of work. Or if someone says, no, I can't work because I need to get disability benefits or I already have them and I don't want to lose the only safety net I have. That's a conversation where we have to do benefits counseling with someone and help them understand what their options are when it comes to working and maintaining some or all of their benefits for a time when they're working. So that's where the process starts with our clients, and Pat and I see it as our job as to help people get to a place where they feel they're ready to start looking for work and then keep that job and then get to a better place financially. Next, all of our clients have to be between 18 and 70 years old. The average age of our clients so far is 47. And I think it's also worth noting that about half of our clients have less than a GED or a high school diploma. And by comparison, a study found that a quarter of the general population of people in jails and prisons have less than a GED or high school diploma. So our clients have double that rate. And I think what we might be seeing here is a reflection of the fact that many kids with disabilities may not get the support they need to succeed in school, and that kids with disabilities are nearly 3 times more likely to be arrested than kids without disabilities. And additionally, over 80% of our clients in the FAIR program are Black. And a national survey found that 1/3 of people with disabilities are arrested by age 28. but that 55% of Black people with disabilities in the US are arrested by age 28. And so these figures are astounding, and we just have to remember that the clients we serve in this program are not just facing barriers related to their disabilities or a criminal record, but that the vast majority of them are also facing structural racism as well. And I'm going to tell you a bit about our process. And we receive most of our referrals from local community organizations that serve people in reentry. We also have received some from LRS. We've received some referrals from the DOC and from probation and parole and mental health courts, but the vast majority are coming from those community organizations that work with people who are coming home from incarceration regularly. So when we start services with clients, we start it in a meeting that can take about an hour, sometimes more, and it can take place in our office. It can take place somewhere in the client's neighborhood where they're most comfortable, or it can happen over the phone, which obviously in the last year, that's been more prevalent. But in the first meeting, we do what we call our baseline assessment with clients, which most importantly helps us identify clients' goals. And so, during this assessment, we're engaging clients in a conversation around how they envision a successful future for themselves, what that looks like 6 months from now, a year from now, 5 years from now, whatever the client's ready to envision. We want to talk to them about what that looks like. Where are you living? Who is in your life? How do you get around? What are you doing regularly? Those kinds of conversations are able to, put someone in the mindset where we can then start to tease out some very specific financial components of those goals. And those measurable, feasible, and specific goals are what kind of frame the whole purpose of our program. That's what we're going to be working towards with clients. And these are important because they're goals that are, goals that aren't going to change, that speak to someone's personal value system and are going to help push them through the setbacks that are definitely going to come. And so some common financial goals that we work with clients towards are saving for an apartment so someone can live independently and cover all their bills on their own. Often clients will tell us they want a car. Often clients will tell us they just want to be able to start sending money to their grandkids or be able to save for an emergency to just have that kind of peace of mind. So these are the discussions that are most important with our clients because they drive the whole program for us. And then we screen for barriers in all of the categories that Pat had discussed a few slides back. Challenges related to housing, healthcare, education, job training, legal issues, banking, credit, and debt. And this starts a discussion about potential solutions to these concerns, and we find out what barriers they want to address first. What's most pressing to them right now, because that's what we're going to start on. And then we outline together specific action steps that both we as the coach and they as the client are going to take. And we lay out specific timelines for when certain things are going to happen. And we lay out who's going to do what, whose responsibility is what. And then we typically schedule follow-up meetings. It depends on the client, but we try to do it at least twice a month with a client. So every 2 weeks. And in those meetings, we figure out what's been accomplished on each person's end, what kind of new issues we all ran into, and what next steps we both need to take to help them keep moving forward. And this process is going to continue until either all the feasibly addressed employment and financial barriers are addressed, or until the client decides that they don't need our assistance anymore. And for some clients, that can last about 6 months. And for others, that's about 2 years. We're definitely still working with clients that we met in the summer of 2019. So, moving on. On this slide, you can see some of the most common issues and priorities that our clients asked us for assistance with during the 2 years of our pilot, which we're just coming out of. That pilot ran from June of 2019 until June of 2021, so very recent. But so here you can see some of the most common needs. And I'll only go into a detail on about half of them and just really explain give you examples of how they play out in practice. So first, you can see that the majority of our clients needed our help with getting income supports. And the reason for this is that when we meet our clients, they typically, like Pat said, they have no permanent residence and no income at all. And most of our clients are staying temporarily with friends or family, but some of them are unhoused and living on the street. And in these scenarios, our clients either have no money to rely on at all, or typically have to rely on others for basic necessities, which is unreliable and extremely stressful. And it makes it nearly impossible for someone to be able to really focus on a job search if they're not sure how they're going to eat or how they're going to get clothing for an interview and things like that. And because of that, we spend a considerable amount of time with clients at helping them access public benefits like SNAP, Social Security disability benefits, unemployment insurance, stimulus checks, and other income supports that they might be eligible for. For example, one of our clients had started working at a restaurant a few months before COVID hit. And in March, he was laid off because of the pandemic, and Pat was able to help him apply for unemployment insurance so that he could take care of his kids and pay his bills until this passed and just remain in the community and able to make ends meet until he could get back to work. And I don't know if anybody else remembers how horrible it was, especially in the beginning of the pandemic, to try to get a hold of someone on the phone at the Workforce Commission to try to file for unemployment over the phone, but it was nearly impossible. And being able to do things on the computer like reset passwords and just navigate the website is very difficult for a lot of the people we serve, even if they do have access to a friend's computer or their own. But that was, just having someone to walk him through that process was incredibly important, and it helped him kind of weather this storm and be ready when the restaurant opened up again and was ready for him to go back to work. The second most common need was accessing healthcare. Like Pat mentioned, most of our clients, when we meet them, have no medical care in place. And so when we meet someone, often it's a race to help them get medical care quickly, so that way they can remain stable and as healthy as possible and be able to engage in a job search down the line. For example, this is something that has happened more than once, but one of our clients who has bipolar disorder and schizophrenia, he had run out of his medication by the time he met with us, and he shared that he was feeling very unstable. And we were able to help him look around for a mental health clinic that could get him in that week, because a lot of places were saying, oh, it's going to be 3 weeks out or more. And we were able to get him in that week with DePaul. And then we were able to help him get Medicaid funded transportation to and from that appointment to make sure he could get there and wouldn't miss it. And our assistance in this area has become more and more important throughout COVID as more doctors' offices are moving to a telehealth format. And again, a lot of our clients need some help in figuring out how to do that on their phones, how to do a Zoom meeting or just some sort of video call with a doctor and how to schedule that. Because again, if you aren't familiar with the technology, it's going to be really hard to even know where to look up to find a doctor. So we've done a lot of work in that area. And then next, our clients often need help with a job search. And the intention of this program is not job placement, because there are countless organizations in our area that do job placement for both people in reentry and people with disabilities. So rather, we're here to try to help connect the dots and address issues that kind of fall through the cracks in between job placement. And when possible, we work to help clients connect to the job placement or vocational program that's the right fit for them and their goals. And for some clients, that's Louisiana Rehab Services or an employment network that's funded by Ticket to Work, like one of Pat's clients who's living with a substance use disorder and who became blind in recent years. Before he was ready to start looking for work, he needed training and assistance from LRS and Lighthouse on adaptive techniques. And now he's gotten that training, and now he's going to interviews for jobs. For other clients, some of them may benefit more from just job placement services from a reentry focused provider. Like one of my clients who, when we weighed out all the different options, he opted to go with a basic professionalism and life skills course through Urban League's Strive program. And then after he was finished with that, he decided he wanted to be a forklift operator. So we connected him with Job One. He got that certification, and then we worked with a reentry job placement specialist at Job One. He gave us leads on employers that are friendly to people in reentry in that industry that he was looking to work in. And I helped him write his resume and cover letters and submit those applications. And he's working full time now and has been for about a year. So I think it's important to note that none of our clients come to us specifically seeking financial coaching. And I think that's because our clients have very pressing needs, and a financial coach is never your first go-to for how do I get help in this kind of crisis situation. But we have found that most long-term and short-term goals and needs have a financial component. So we have learned how to incorporate some of those common financial coaching activities into our clients' services and into their action plans as a means to those more immediate, to addressing the more immediate needs. So for example, a very common one of our clients was living with her daughter. She needed to get out very soon, and she needed an apartment of her own. So she had just started working and she was on SSI. So the first step was to help her figure out exactly how work would impact her SSI. So she knew exactly what her new total income would be. And then we helped her identify what expenses she has regularly. And then we could set a budget for an apartment. So she knew exactly how much she could afford. And we helped her with that online apartment search, and she's living on her own now. Another client had a goal of becoming a chauffeur. That was the career he'd had years before, before he was incarcerated. And he wasn't eligible yet to get his chauffeur's license again because he had all these holds at the Office of Motor Vehicles. He owed $1,800 in fines and fees in traffic court. And then he also owed $20,000 in child support, which had accrued while he was incarcerated. And so the first step was for us to help him get a provisional driver's license, which is created specifically for people in that scenario who have been incarcerated and need to be able to drive, but need some time to be able to pay off these debts. And so that bought him a year of driving privileges. And then in the meantime, we connected him with our partner who our organization contracts with, which is the Justice and Accountability Center of Louisiana. And they helped him identify that all of the $1,800 in fines and fees, those were all from issues that predated his period of incarceration. So they were old, and all they had to do, I don't mean to diminish, it's not all they had to do, but what they had to do was go to a judge and advocate for him and explain that he's served more time than this charge would have ever required. Can we give him credit and let him move on and pursue his career? And the judge agreed, and they cleared that $1,800 off of his record. And so now, since then, he's started working at an auto mechanic shop. And now we're finally in a place where we've been able to set up a budget so we know exactly how much he could potentially afford in a child support payment plan. And we are clear now that he can afford at least $100 a month for that payment plan. We've already made the first call to DCFS to put that in place, and we're waiting for a call back. And once that's all finalized, he will be eligible to get his chauffeur's license again. And then one more example of kind of financial coaching in action is after, one of our clients, after working at his job for a year, he shared that he wanted to purchase a car because he's been traveling by bus from the West Bank to the East Bank daily, spending hours, and it's getting harder and harder with all the rain and with his disabilities. And so we began this process by pulling his credit report, and we found that he owes credit card debt. And we found that he's luckily been paying, making the minimum payment on it every month, but he didn't understand that interest was growing on it. And he didn't know that it was problematic, that he was using, 80% of the credit limit. So when we were able to talk all that through, he was able to start paying more on it. And eventually he used his tax return to just pay off that credit card debt. And now he's still using it, but just only a little bit a month and paying it off immediately. And his credit score has gone up by about 100 points. And so the next step is he wants to build some savings for the car down payment. And for us to navigate that, we have to understand that he is on Medicaid as a SSI recipient who's in non-pay status because of his work. And he'll lose Medicaid if he saves over $2,000. And he's not eligible for an ABLE account. And after discussing the options, he's chosen to pursue this route anyways, save the money, and he's going to forego Medicaid because now he can opt into his employer health insurance. So financial coaching is often much more practical than I think people think. There's all these, it's just relevant. Finance and money is relevant to everything in life, even if we don't want it to be. So those are just some examples of how we've used that. So next slide. So how do these, what does this all actually mean for our clients and their employment and their financial outcomes? We think it means a lot because between June of 2019 and June of 2020, about half of our clients got jobs, and 71% of those clients who were employed kept those jobs for over 90 days. And just by comparison, in 2018, only 33% of all working age Louisiana residents with disabilities, regardless of criminal record, were employed. And I think this is significant because we know that people with criminal records, regardless of disability, are 50% less likely to get a job offer. And we also know that over 2/3 of this pilot took place during the pandemic, where we saw unemployment rates that were significantly higher than in 2018. And then we also found that our clients were almost 3 times more likely to get a job and maintain it for 90 days or more than were formerly incarcerated people in the greater New Orleans area who just received job placement alone. Additionally, over half of our clients increased their income by an average of 300%, meaning that they have 3 times more income now than when they entered the program. And almost half of our clients reduced their debt by an average of 37%. And this huge chunk of debt reduction, that's total across the program of $55,631 in reduced debt. A lot of that is in thanks to our partners at the Justice and Accountability Center, who, as I had mentioned before, are working with our clients to address those court fines and fees that really add up, that predate incarceration. And it's also due to the efforts of our clients to, once they're able to start working, they are able to start chipping away at those debts piece by piece. And then it is worth noting too that as far as that's been reported to us, we've only found that 5% of our clients have been arrested and returned back to jail over the course of this project. And just for reference, 27% of people who are released from DOC custody come back within 2 years. So, and I think over 5 years, just in the state, it's 43% of people usually return to incarceration. So we are hopeful that this 5% does mean something significant, and we're going to keep tracking that more now that, we're going to have a 5-year at least program run. So more to come on that. But let's see. So what did we learn? One is that flexibility and holistic services are key for this population. And that's because our clients are often rebuilding their lives from the ground up when we meet them. And job placement alone just won't cut it. And if we've learned nothing else from COVID-19, it's that major setbacks can happen and will happen, no matter if anyone's at fault or if mistakes are made. These things are going to happen. And when our clients lose jobs or lose stability in any way, they need support in finding a legal and reliable means of making ends meet so that they can stay in the community and stay poised and ready to pursue the next opportunity that comes their way in terms of employment. And then we've also found that financial coaching is an effective strategy for improving employment outcomes and motivating job seekers to help them see progress towards their goals. And that's, you know, the most important aspect of financial coaching is that we're letting clients lead the way and set the terms of their goals and their services. And this does help people stay engaged and on course because we're only working on things that they care about and that they need. And we also found that when we meet clients, many of them don't have bank accounts. Most haven't managed bills on their own in a very long time. Most have never seen their credit report, filed taxes. Many owe money, but they're not sure how much. And many have been told they shouldn't try to work or save money because then they wouldn't be eligible for disability benefits, or they could lose the benefits they already have. And so we wouldn't be helping our clients secure long-term success if we didn't help address these financial challenges that will, without a doubt, rear their heads eventually. And being armed with the training to be able to kind of field these issues has been really valuable for me and Pat. We know not every organization has funding for financial coaching training or a financial coaching department. If you do, we have nothing but great things to say about the Change Machine, which is where we got our financial coach training. But otherwise, there are lots of free trainings that people can find online through the Consumer Finance Protection Bureau. They have this Your Money, Your Goals series, and they're self-paced. And then the National Disability Institute also offers a lot of trainings on financial topics related to people with disabilities. And then the next thing that we found is that community engagement and resources are about as important as can be when you're serving this population. And that's because, you know, we can't, all these organizations, none of us can be everything for everybody. We can't be the experts on every topic or provide the resource for everything, but there's just incredible work being done all over the state. And in New Orleans, we've been really lucky to be able to plug into a network of reentry organizations that do incredible work for people in reentry. And we also came into this being well aware of the incredible work that the disability service community does. And so what I would say is if you are looking to, you know, find ways to try to meet some of these needs that we've talked about with your clients who are formerly incarcerated or your loved ones, I would say, you know, have on deck a little resource guide for your area that covers these topics: job training, healthcare, legal issues, financial services, and general reentry services. And also, we left this out too. I don't know how we did that again, but housing. I think, you know, housing is one of the biggest challenges to solve because there's just not enough of it. There's not enough affordable housing anywhere in the state to my knowledge, but I think, you know, just even having on deck and available emergency shelters, like a list of those and what it takes to get in and when to line up, and any transitional homes in your area, anything like that can help somebody at least start to gain some sort of sense of stability. But I think that concludes everything. And on these last two slides, you can see the references that Pat and I discussed. And last but not least, our contact information. If anyone has follow-up questions or thoughts that they want to email us if we can't get to them today. Does anyone have any questions?
Hi, Libby. We do have a few questions. First off, this was an amazing presentation. The work that you're doing is really great, and you shared so much good data and information, so I am wowed by it. But ask a few questions. Let's see, from our chat, we had a question from Jim, What access do incarcerated disabled persons have to VR services and assistive technology while in jail? And are they typically part of the general population or segregated? And if Libby, if you can quit sharing so that people can see everyone.
Yes. Yeah.
So I kind of responded to this one. And I just responded based on information that I've received from clients that I've served. From my understanding, there's very little, if any, VR access for people in jails in Orleans Parish Prison, which is most likely the jails that people are coming to us from. I haven't heard of a client coming to us stating that they were receiving VR services before they were released. I don't know if you have something different, Libby, but that hasn't come up for me.
It hasn't come up for me either. I know a few years back, LRS was doing a really good effort to try to do some in-reach at some of the prisons locally, but I don't know to what extent that's still happening, and I haven't heard from clients. I haven't yet met with a client who's shared that they were aware of the resources. And that's something that's been interesting too, is I think, I'm coming from a program where a lot of the people I worked with were on disability benefits and were really immersed into the network of disability related resources that were out there. And with this population, it's very new to them. But that's a good question. Thank you for asking.
And in regards to if they're a part of the general population, they're typically a part of the general population from my understanding. They're not segregated. The only segregation that really occurs is in solitary confinement for, there's a huge population of people with mental health or mental illness diagnoses that are just disproportionately put into solitary confinement due to the lack of mental health supports in DOC facilities. And so at that point, you do see some segregation, but in regards to them inside the facility around other folks, I don't think that there's any segregation going on there.
And I have a question for you guys. I mean, the work sounds incredible and just such important and meaningful work. And you talked about one another. Are you the only two people doing this work? And how many clients do you serve?
So for right now we are, but we are in the hiring and interviewing process to add a third teammate to our team. So we're very grateful for that and excited. We have, throughout the last 2 years, so up through last month, we served 91 active participants, we call them. So those are people who were eligible for the program, were engaged in it. They came to the baseline assessment meeting, and then they attended at least 2 follow-ups with us. So that was 91 people total. We had gotten about 250 referrals total, though, over the 2 years. And some of those clients were ineligible, but got some good information on referral services. Some of those clients were, unresponsive for whatever reason, and some weren't interested. But yeah, and now that we've launched again, so we put things on hold while we were waiting for a more steady source of funding to come through to carry us through for a significant period of time. And we started the referral process again last week, and we already have 22 new clients. So the pressure is on to get our third teammate in, but we are triaging those intakes and starting that baselining process with everybody, and we're really excited about it.
That's great. That's incredible. I mean, it seems like it would take a lot of time. It's individual time and dealing with so many different complex issues that this population has to deal with. That's what I was asking. The two of you are doing that incredible work, and I know that it takes a lot of time interacting with people one-on-one. Really appreciate that. We had another question, which I know you are familiar with, the PASS program at Social Security, and do y'all use that program? Are there any of your clients utilize that?
Not yet, and I'm sorry if you can hear the ice cream truck driving by. It'll be gone soon. But you know what? We haven't had a fair client that's used PASS. We used to be, or I used to work in our WIPA program where I was familiar with, creating PASS plans more often. But I would love to see that for some of our fair clients. We just haven't gotten there yet. Because that's just a great opportunity for somebody to save without impacting that resource issue. So thanks for bringing that up.
And then we have another comment from Jim. In 1977, we sponsored a Vietnamese refugee to settle in the US. Are there similar programs where people can sponsor a disabled person?
I haven't actually, what's funny is a couple I wish I could remember because it was years ago. Somebody came and did like a lunch and learn at our office, and she did have there was some sort of program where it was an elderly person could opt to have a roommate. And I don't remember if it was specific to any unique population, but yeah, I mean, and that would be an amazing program for formerly incarcerated people if someone could opt to sponsor somebody and have them stay for a while. So we haven't heard of that. Until then, I think the closest thing is transitional homes that there are groups in at least New Orleans that are trying to make that as widely available as possible, but space is always limited.
Yeah.
Very good. Do y'all have closing comments? I don't see any more questions in the chat, but we give you an opportunity to close if you would like.
I would just say if any of you guys are struggling to serve this population in your areas, or if you are a part of this population and need resources and aren't, in our service area, I would be happy to brainstorm with you or reach out to contacts to see if there's, similar resources that we rely on here in your part of town or part of the state. So feel free to reach out if you have any questions or thoughts. I'll leave it to you, Pat, for any other leftover.
No, I would just state what I stated earlier, and this comes from Caroline Casey from the Valuable 500. Is that there is in fact a lot of ability and disability, and it's about time that we start pushing folks and the policy teams and our state representatives to really get on board with understanding that and pushing policy around it.
Thank you so much. Important closing. Thank you again for all the work that you do. It's very important work, and appreciate you presenting at our conference and wrapping up our third day of the Governor's Office of Disability Affairs Conference. Just want to remind everyone that tomorrow is our last day, and we will kick it off at 9 o'clock in the morning, and we have 4 sessions lined up for tomorrow. So we will see you all online again tomorrow. Y'all have a good evening.